Hope everyone's doing well. And I guess you're excited about the Steelers game tonight. Don't know how I feel about that, but fingers crossed, I guess. I don't know. We might be able to pull it off. You never know. But with that being said, good afternoon. I'm calling the meeting to order. Why don't we start by taking roll call? We'll start with Abbas Kamara.
Present.
Judge Lazara. Corey O'Connor, County Controller.
Here.
Terry Klein.
Present.
Richard Fitzgerald, County Exec.
Steve Polarski.
I'm sorry. I know, but we don't shout out in the meeting. It's rude, and we don't like to disrupt other people. So please do not do that. Sheriff Kraus is not available. Gail Moss.
Present.
County Council President Pat Katina.
Bethany Hallam, present.
All right. So, yeah.
Point of personal privilege, I would like to object to the participation of a legal designee, Steve Polarski, and his vote should not be counted, and he should not be allowed to sit up here and participate in the meeting.
So with that being said, we'd ask that everyone in the audience extend the same courtesy that you would expect in return. We do not, please do not speak over others, cut people off, yell out while people are speaking. Everyone has a right to speak, and they have a right to be heard. And public comments will be restricted to 3 minutes. If you did not sign the sheet, you'll not be permitted to speak. So if there's anyone that wants to speak, we need you to sign the sheet in order to be able to give a public comment. With that being said, we will start with Community Corrections Report, Passages to Recovery.
Hello, good afternoon.
Good afternoon.
I'm Michelle Morris. You need me to spell my name? Last name? M-O-R-R-I-S. Okay. It's Michelle, M-I-C-H-E-L-E, Morris, M-O-R-R-I-S. And I'm with Passages to Recovery. On my report for today is that we currently are housing 34 residents, 7 females and 27 men. We have 27 residents who are inpatient treatment services, and 7 of our clients are doing outpatient services with our program, our outpatient component. Successful completions from the last time that we were here are 6. And in regards to training and employment, we have currently 5 clients employed, several clients who are attending training, Beauty Academy, the Positive Care Technician program at UPMC, and Breaking Chains. And we also just started our new GROW program through Pennsylvania Women's Works, and also are starting a new program, Right Pittsburgh, which is formerly Walls for Words. So if you have any questions for me? Yes.
Was that County Controller O'Connor? Were you grabbing the mic? Ms. Hallam?
Yes.
Hi, yes.
Hi.
Have any of your residents had any overdoses in
No.
the past month? Any deaths of anyone?
No.
All right, thank you very much.
You're welcome. Thank you.
Any additional questions? All right, thank you very much, ma'am.
Thank you.
We now hear the report from the Renewal Center. And again, I apologize for not stating this earlier. When you go up to give a statement or a public comment, please state your full name, spell your last name for the record, please.
Good afternoon, everybody. My name's Darren Hood, H-O-O-D. I'm with Renewal Incorporated, Director of Reentry Services. Report I have today is currently we have 89 in work release, county reentrance, 16 inpatient, giving us a total of 105. Our employment percentage is at 70%. Average wage is at $16.29. 42 reentrants exited our program, 21 successful, 12 escapes, 7 program revocations, some pulled out by court, some returned for behavioral issues. There will be several county reentrants participating in community service for the EQT Pittsburgh 10-miler marathon Sunday, November 5th. And we have a lot of great seasonal community service opportunities for renewal reentrants coming up later in the month as well as next month to kick off the holiday season.
The young lady?
Yeah, this is Elena DeTore. She's our clinical director, and she's here to talk about treatment with NA and stuff.
Hi, my
Hello.
name's Elena DeTore, last name Dettore. Just in general, our treatment groups cover the following, but are not limited to mental health, health and wellness, MAT, connecting with others, ABCs of thinking, co-occurring disorders, drug education, reentry back into the community, focus groups, and mindfulness. And in addition to those, we have reentrant-led peer groups and 12-step meetings. Most have been led by the reentrants themselves. We did 2 weeks ago have a speaker come in and run an NA meeting, and she will continue to do so as often as possible. And I'm looking into more 12-step speakers, along with ministry, education, and worship, and reentry.
I did have a question.
Yes.
And maybe you said it and I missed it, and I apologize. But how many meetings per week do you have for like AA and NA?
The peers, the reentrants run their groups, and that's one time per week
For each or for together, combined?
for each floor.
Okay, I meant like, so is there a separate meeting for AA versus NA, or is that a combined meeting?
Right now combined,
Combined, and one per floor?
yes,
And how many floors?
4.
4 floors.
Well, 2 with county residents.
Okay, thank you. Ms. Hallam?
First of all, thank you so much for coming, and thank you so much for bringing her. I'm really excited to see you here. My first question is, has the facility experienced any overdoses in the past month?
No, and Darren's prepared to answer those questions, if that's okay.
Oh, do you want me to finish asking you questions
Yeah.
then and then ask him that after? I can definitely do that.
Thank you.
So I know that when I was in Renewal Center, we actually went outside to NA and AA meetings on the street, and it was a very like supervised thing, and it was specifically only for the folks on the rehab pods of the jail, both men and women, of Renewal, both men and women. Do you have any intention of resuming that service? Because I know it is a very different experience to get like a community 12-step meeting versus a, peer-led from the same facility as me 12-step meeting.
I think it's something that we're willing to start talking about. For right now, we're comfortable bringing speakers in, and but I will take that back to the team, and we'll discuss the possibility of that.
Okay, can you speak to any barriers that have prevented that, like either right now or in the past?
I can't speak to that in the past. Right now, I'm just arranging the behavioral programming of the units and getting things started and running the way that, under my supervision. So I don't really have an answer for that, but I plan on coming back, so those are things that I can discuss further.
Okay, yeah, I would love that very much if you had come back. Do you know why the outside meeting stopped in the first place?
I do not.
Okay, and then specifically you mentioned MOUD. Can you speak a little bit more to like what the MOUD program is at Renewal and who's able to participate? Did they have to have a prescription prior to coming to Renewal? How does that work?
The MAT groups, just that they're educated about their right to, utilize MAT, and it's more education-based than anything, I would say.
Okay, so is it actually being provided? Like, are the medications actually being provided to folks who participate in this program, or is this more just an educational program?
We do have people that are on Vivitrol, Suboxone, and Sublocade.
What about methadone?
We will be starting that in the near future.
I know you probably don't have an answer to this, but I'm going to ask anyways. Do you have a timeline on the implementation of the methadone program?
I don't, but we just had one of our final meetings with TDISO today, and so I would think that's coming very soon.
Awesome. They are great. I'm glad to hear that. Is the education program component that you talked about, is that a requirement for anyone receiving MOUD, MAT?
Yes, they would take part in that.
Okay. regardless of which of the medications you're receiving, you have to participate in this program.
And
is
the
that
nursing staff is very good with the education of those things and making sure that people understand their options and side effects and everything like that.
awesome? And then what about anybody who doesn't currently receive that kind of medication? Is there any sort of programming for them to maybe learn if it's a good option for them, if it's something they should explore?
So those are things that are talked about even right at admission in our intake receiving screening. Education is provided at the time, and they have the option to do that if they would like to.
Awesome. And then what about the prescriptions actually for those various medications? Is that something that you or providers at Renewal initiate? Or, like are you doing induction with folks that come into Renewal, or is everyone who receives it, did they have a previous prescription?
For Vivitrol, we will start. Suboxone, we continue. Methadone will be taking on those that have been on it inside the jail and coming to us on it.
Okay. And people who come in to Renewal from the street on that? Okay. But they will, what about Sublocade? Is that something that you're just continuing as well?
Yes.
Okay. And then do you have any plans to start induction on Suboxone, Sublocade, or Methadone?
I am not sure at this time. I would have to discuss with medical and everything like that, but we have a PCP that's very educated and well-versed in the research with those things, and there's been conversations about different changes and everything.
Thank you so much. I truly do appreciate you being here today.
Yep, no
Thanks.
problem.
Any additional questions?
I just had one question. Any overdoses, any deaths in the past month?
Yes, unfortunately, we did have a death. On 10/14/2023 at 6 a.m., staff responded to a medical emergency on the 8th floor of our female inpatient unit at 704 2nd Avenue. The incident involved Pennsylvania Department of Correction female reentrant who was found unresponsive on the unit. The reentrant was transported to Mercy Hospital by first responders, where she was later pronounced deceased. The incident was previously reported to the Allegheny County Jail and Allegheny County Jail Oversight Board on 10/14/2023. This incident was thoroughly investigated by the City of Pittsburgh Police, PA State Police, Division of Drug and Alcohol Licensure, Allegheny County Drug and Alcohol, as well as internally, and the cause of death is still unknown. And we did have one possible overdose on 10/20/2023. We had a male Allegheny County Jail reentrant located at 339 who was found in medical distress. Staff performed life-saving measures, Narcan, and revived the reentrant. It was reported to the Allegheny County Jail as a suspected OD. The reentrant was subsequently transported to Mercy Hospital via first responders, spent a few days in the hospital, and was subsequently discharged. Any further questions on the matter would have to be referred to our CEO, Doug Williams.
Okay, thank you. So just a couple of follow-ups on that, not specifically, about what happened, because I know that you don't really know that yet. The person who was the possible OD, what is the policy for something like that happening? Is that person allowed to return to the facility after they were discharged from the hospital? Or when you say they were discharged from the hospital, does that mean to the jail?
They're allowed to be, all the jurisdictions can return. What's determined from there with Allegheny County Jail staff, PA Department of Corrections, or Federal Bureau of Prisons, that they ultimately make that decision.
Okay, the jails, not like courts or probation or anything, the correctional institutions are the ones who make the decision if the person returns or goes to jail?
If they suspect it's a possible OD, I mean, it varies in different cases. There's no concrete answer.
Okay, did this person return to your facility?
They did not.
Okay.
Well, they did, but they were returned.
Okay. And then my only other question is the person who died in the facility on 10/14, was that a new admission to Renewal? Was that somebody who had been there for a while? I think that's a 60-day inpatient program, so I'm just wondering how long into their treatment they were.
I don't have the amount of days that individual was in a program.
Okay. All right, thank you very much.
You're welcome.
Any additional
Thank you.
questions? Thank you very much. Thank you. Electronic monitoring.
Good evening, Board. Steve Eswine, ESSWEIN, for the Probation Office. So for the report period ending, we had 617 individuals being supervised. During that time, we have 90 successfully complete, and 8 were removed for various violations. So, any questions?
90 successfully
90
completed?
successful.
Meaning they served their sentences?
They served their complete EM sentence, yes.
So what if a person is sentenced to serve, no, I'm sorry, not sentenced, but someone is placed on EM pretrial by a judge in a court of common pleas?
Yep.
And they ultimately receive a sentence of incarceration. How do you classify that person leaving EM?
They would be successful leaving EM, and then, because they didn't violate while they were on EM.
So it would still be
So is
a
it-
successful outcome,
Yes. Yep.
even though they were removed to serve a sentence?
Yes. Yep.
Okay, any other questions, Ms. Hallam?
The 8 folks who were removed, the
Yep.
non-successful completions, does that mean they all went to jail?
Yes, they did.
All right, and did you have any overdoses or deaths of folks on electronic monitoring in the
that I
past
know
month?
of,
All right,
Okay.
thank you.
Thank you.
Thank you. That being said, we'll now begin with our public comments. Excuse me. First on our list is Tanisha Long. And again, your comments must be restricted to 3 minutes.
Hi, Tanisha Long, TANISHA, Long. I'm here to speak on 2 issues, and I'm going to try to speak quickly. The first issue, I was sent here by Ms. Tipton, Aaron Tipton's mom, because her son, Aaron Tipton, is facing retaliation inside the Allegheny County Jail. The correction officer who broke his arm, Officer D'Angelo, continues to be placed in charge of him, continues to interact with him, continues to make comments, which is triggering to his PTSD. You could imagine how you would feel if the person who broke your arm was still placed in a position of care and still allowed to impose their will on you. Also, Correctional Officer Sarver has made sexual comments about Mr. Tipton's mother, has made comments that are triggering to Mr. Tipton, and has made comments and references to lawsuits that Mr. Tipton has against the jail. So if someone could investigate this quickly, that would be great. I am letting you know, Warden, that this is on public record, so you can't pretend you weren't made aware of it. So you have a duty to intervene. Furthermore, I would like to talk about the jail's discharge and release process. When people are released by the court, the jail gives them a window of up to 48 hours to be released from the jail. The problem with that is that for those of us who coordinate services, housing, treatment, we don't know when they're getting out. And the people at the Discharge and Release Center are probably the nicest people I've ever talked to in the jail. And they work overtime to try to get me a time frame. But when medical doesn't do their part to get the medicines down in time, we have people who go far past that 48-hour window. We have families who have sat camped outside of the jail for 2 days being told that their person is going to be released, and they never come out. I have someone who we were trying to secure a bed for in a sober living home, and the jail could not give me a time frame on when this person would get released. And through my calls, I found out that it was because they were waiting on medicine to come down that literally had been sitting up there since 5 a.m., and they didn't make it out that jail till 6 p.m., and that's only after persistent calls. They almost lost their space in a sober living home because the jail cannot provide us an accurate time frame of when people will be leaving the jail. That's a problem. We need to get this system down better. Also, for a third issue, I had someone who just left the Allegheny County Jail, and in his first 3 days there, his first 3 days on a pod, he was not allowed to leave his cell at all. That's 72 hours without a shower, without rec time, without being able to leave at all. This is a clear violation of the solitary confinement referendum. You know you're wrong for this, and this is not okay. So in these 3 areas, I'm really asking the board to intervene, and I'm asking you to act quickly because these are human and civil rights violations unless the county is really committed to paying people out for lawsuits based on retaliation, losing housing, and actual physical harm. Thank you.
Thank you. Laura Perkins.
Hello, Laura Perkins, Perkins. In Pennsylvania state prisons, incarcerated workers are paid an hourly rate for their labor. There is a basic acknowledgement that no one should work for free and that we have the duty to compensate people for their labor. In the Allegheny County Jail, we value the labor of incarcerated people at $0 an hour. Nothing. We do not give a single penny for the time and physical labor of the people keeping the kitchens running and the pods clean. In Allegheny County Jail, we make sure to let these workers know that we do not feel they are worth anything, and we reduce them to being just a DOC number and a way to save the county money. How can we justify such a dehumanizing practice in a country where we claim to have outlawed slavery? Does committing a crime mean that you don't deserve a basic human right? I think it is important to remind members of this board that most people in the Allegheny County Jail are awaiting trial for a crime or a violation they have not been found guilty of. That does not give us the right to take ownership of them and exploit them for services the county does not want to pay for. Councilwoman Hallen is asking that we pay workers $10 a day, less than $2 an hour. That is the amount that she is receiving pushback for. How much would it cost the county if we hired people to do the work that these incarcerated people are doing? Much more than $2 an hour. How are these people supposed to pay restitution, make phone calls, and buy from commissary? At this point, there is no logical reason not to pay these people, and it is clear that cruelty is the motivating factor behind the efforts to kill this motion. We are not better than the people in the jail. We are not worth more than the people in the jail. We are not more human than the people in the jail. We do not deserve more than the people in the jail just because we are not in the jail. We are all people who are deserving of basic human and civil rights, which include the right to have our labor compensated and be free from exploitation. By paying workers in the jail, we take time off the burden of the families who struggle to put money in their accounts to pay for phone calls, commissary, and help pay fines. We encourage incarcerated individuals to seek gainful employment upon release. We show that we are a county that is capable of doing the right thing. If this Jail Oversight Board cannot meet this obligation to pass motions that improve conditions at the jail, then who can?
Dalen Davis.
Good evening. Dalen Davis, currently serve as the president of the NAACP Pittsburgh branch. The Allegheny County Jail's practice of using incarcerated individuals for forced labor is deeply concerning. While people are confined and sentenced to jail as a punishment, this should not equate to providing free labor for the jail. The jail's demographic population is disproportionately composed of blacks, raising questions about the motivations behind maintaining a system that relies on forced labor. Inside the jail, individuals have little control over their daily lives, from their living arrangements to meals, clothing, medication, and visitation rights. They are denied the choice of whether or not to engage in unpaid labor from this institution. The jail's administration argues that having a job is a privilege and offers additional freedoms, but this should not be used to justify exploitation. Equating an extra food tray with a full day's pay is an unjust practice. Many incarcerated individuals have court fines and fees to pay upon release, and there are victims awaiting restitution. However, the current system leaves those who have been incarcerated in debt even after working more than 40 hours a week. Instead of perpetrating this cycle of indebtedness, a more rehabilitative approach would be optimal. As a suggestion, let's compensate our incarcerated individuals for their work, helping them meet their financial obligations upon release. Releasing individuals from jail without any money, especially for extended periods of time of incarceration, sets individuals up for failure and potentially leads them to recidivism as they resort to crimes of necessity. This so-called revolving door of justice can be addressed by ensuring that individuals leaving jail have a better chance of reintegrating into society if they were paid. The oppressive conditions within Allegheny County Jail make the offer of free labor enticing to those who incarcerate. This Jail Oversight Board has a responsibility to care for and advocate on behalf of incarcerated individuals. The lack of progress on the motion presented by Councilwoman Bethany Hallam is disheartening. And those are my comments.
Thank you, sir. Brad Korinsky.
That's a shame to follow the best public comment I've heard in about a decade. That was great stuff. And want to congratulate Sheriff Kraus for following the rule of law and doing what every official in a government body from Krakow to Kalamazoo does when they can't show up somewhere. They just don't show up. They don't exercise a privilege to appoint someone or dragoon someone to appear in their stead. So shame on the folks who are jail statute nullifiers for defending their privilege to appoint someone for not attending. So I'm here to talk about something in collaboration with my colleague John Kedstowitz on conducting exit interviews. So I'm going to read from a statement that we've prepared. December 2020, the board voted by a count of 6-1-1 to conduct staff exit interviews. Judge Lazara made the very trenchant comment that the board should conduct interviews with former jail staff who are lower on the hierarchy and not just administrative staff board members. Besides interviewing former HSA Director Bunce and former Mental Health Director Barfield a couple of years ago, the board has not conducted exit interviews with any former employees. Except recently, our JOB liaison conducted one exit interview. An expanse of almost 3 years have passed since the board voted on this initiative, and the board has essentially made no progress regarding this tremendously important initiative in 3 years. On July 21st, the board was first made aware of 2 referrals for exit interviews for former staff who are eager to talk with board members about the challenges they faced working at ACJ and what recommendations they have for retention and improvements in jail policy and practice. It's going on 4 months, and the board has not been able to coordinate schedules to conduct the interviews. This lapse of time begs the question of what kind of priorities is the board making to conduct exit interviews. Now the board has received 5 exit interview referrals for former staff and will probably be on the way for more if the board takes action. These referrals want to speak to board members, not necessarily the liaison who doesn't have the depth of experience that these members believe that perhaps the board hasn't. If they're going out on the limb to talk to you, they want to be assured that they are going to be taken seriously. So we're speaking about a problem of the severe staffing crisis at the jail that's plagued us for years. It's paramount that we confront this, and probably one of the best ways is to figure out what makes people leave the jail in the first place. These folks have thrown out weekends on their calendar and a variety of other times. Please make it a priority to meet with these folks.
Thank you. Elizabeth Shongar.
Hello, I'm Elizabeth Schonger, SCHONGAR.
Thank you.
All Pennsylvania state prisons pay workers. Bethany is asking for $10 a day for the people working in the jail because council thinks minimum wage is unreasonable. Right now, we are exploiting people for free labor. The county is trying to save money by using slavery-era tactics. And these are mostly people waiting for trial or hearings. The 13th Amendment, allowing slavery for convicted criminals, does not apply. So we have a jail disproportionately filled with black men being exploited as though this is a plantation. And this has consequences that go beyond paying for commissary. Many people will have court fees, fines, or restitutions that they can't pay because they're not working while in jail. Many people end up back in jail again because they leave the jail with nothing to pay these charges. And people who stay months often lose housing, cars, and all their possessions because they can't pay their bills. I saw people who had lost everything as I spent time at the Smithfield shelter before it closed. They had nothing, which is why they ended up at the shelter. JOB has been obstructionist and hasn't passed meaningful motions all year. I'm thinking of that argument about uniforms. It is time to make a difference by voting to pay incarcerated workers. Thank you.
Jody Lincoln.
Jody Lincoln, LINCOLN, with Pittsburgh Prison Book Project. And I'd like to share a piece published this week with Brittany Hallier at Pittsburgh Institute for Nonprofit Journalism. These are excerpts from an essay by Sean Johnson, one of the last children who was housed at Schumann in 2021. I was 16 years old when I first walked through the door of Schumann Juvenile Detention Facility in April 2021. I saw that place weaken people. There's nothing to do at night in Schumann. You are lonely in your cell. I wanted to read books. I needed to read something outside of those walls. But on the pods, there are barely any books that will help you educate yourself and prepare yourself to leave. Law books, books about working on houses, books about skills and trades like carpentry. We didn't have those. There's kids down there who can't read. I saw that in movies before, but couldn't believe it was real. It's hard to think about good things when most of the things they offer to read are hood books, sometimes called urban fiction. These stories take place in cities. They are often filled with profanity, sex, and violence. Those books aren't going to help our situation at all. They're distractions. They call them pacifiers, stuff they give us so we don't complain about the bigger issues. These are the same books they give the adults in Allegheny County Jail. So when you're old enough and you go down to the jail, you're already reading the same thing as the adults. I like to read books like Percy Jackson, Harry Potter, and the Hunger Games. I don't want to read a book about a shootout. That's PTSD. I want my mind to go to another place, another world. We were kids. We should have been surrounded by positivity, opportunity, and education. The only hope was the school program. The school program is the only part that rehabilitates. His essay goes on to detail the horrible conditions at Schumann and the challenges the school program faced, and emphasized how reading and writing helped him survive. I encourage everyone here in public and board to visit Pinge's website and read the full essay from Sean and the other pieces that were published this week about Schumann Detention Center. Sean's words reflect a sentiment Pittsburgh Prison Book Project hears from people who are incarcerated all the time, that books are a lifeline. Books not only offer education and hope for rehabilitation and reentry, but an escape and freedom from the oppressive systems that are designed to crush the human spirit. Whether considering Schumann, Allegheny County Jail, or our other detention centers, books should be championed as an essential part of programming and daily life on the inside. Please take this seriously and create a real library staffed by trained librarians. Continue to expand books available on tablets and create an environment where reading, writing, and creativity is encouraged through the ease of access to books and programming. Thanks.
Rodney Usavega? Usavage. Sorry. I would have never gotten that. There's no E. That's an E at the end?
Yes, sir.
Oh, I thought it was an A. I'm sorry.
My name is Rodney, R-O-D-N-E-Y. Last name is Usavage, Y-U-S-A-V-A-G-E. I was incarcerated from April 17th until September 7th. No charges. It was a violation that held nothing. While I was incarcerated, there were several things that really turned my stomach. You know, I was lucky that I was able to have money put on my books, but a lot of guys can't. 95 cents for ramen noodle soup. Really? It's a ramen noodle soup, something you go and buy 6 of them for $1.09 at, at the dollar store. Everything was outpriced. And when you got money, they automatically, if you owed court costs and fines, they took 50% of that. You know? And then they charge your family if they go up to the machine to put money in, they charge them too, on top of it. The thing was, and the food issue, lack of staff. We knew that come Friday night, we were gonna be locked down till Monday, because there was no staff. So you're stuck in a cell, getting fed on a tray, you know? The showers were horrible. They were clogged up all the time, you know? You look forward to getting a visit once a week from your family. You know, I didn't get visits, but I made phone calls. And then that cost you money. You got 1 free phone call a day for 10 minutes. That was it. You know, and unless you had money on your books, then you could make another phone call. You know, so you had to make a choice: either call your lawyer, call your mom, call your girlfriend, whatever, call your kids. You had to make a choice every single day on who you were going to call. And half the time you were lucky if you can get a hold of the public defender, because they didn't answer the phone. You know, you got a tablet once a day, and be thankful if you broke it. It's a $50 tablet. They're going to charge you $350 for, and you couldn't do nothing until you paid that $350. They were going to take your money till you paid it in full. I'm thankful that One Hood is out there every Tuesday night in front of the jail, you know, helping guys come out. I got released. I was told that my charges were dismissed on a Thursday. I didn't get out till the following Wednesday. 4 days, because they don't include weekends. Weekends aren't included or holidays. So it took me 4 days to get out, and then to find a place to go. You know, because I'm not from Pittsburgh. I'm from originally Harrisburg. Yeah, but my probation was here. Was originally here. I had it transferred. So I had to go and find a place where I could put my head down at night. You know, Light of Life mission was full. So where else could I go? Had to go to 2nd Avenue Commons, and they were full. So that meant I had slept out on the street in the park, you know, at night. I mean, I was thankful it was warm out, but if it was cold, you know, frozen. You know, there needs to be more help for guys coming out. You know, more, you know, being able to make phone calls while they're in there to get a place to go. You know, if they don't have anything. You know, I didn't have nothing, but today I know that there's 5 figures sitting in my bank account because I found a job where I work as a with a marketing executive for Costco. A lot of guys don't have that, you know. So I deposited a check this morning in my bank. I got 2 bank accounts. I'm happy as a lark, you know, because I have a job, even though I've got a criminal background. A lot of guys don't have that. A lot of companies look at you and say, oh, well, you're overqualified or you're underqualified for this position. well, wait a minute, because I've got a criminal conviction, because I'm a convicted felon. You know, what's wrong with that? You know, some of these guys have brilliant minds, artists, you know, and, you know, I thank you for your time today.
Thank you. Thank you. Stephen Fisher.
Mistake.
I'm sorry.
My name's on there by mistake.
Oh, okay, no problem. John Kinstowitz.
John Kenstowitz, Kenstowicz. The choice of Dr. Brinkman's replacement. The choice of Dr. Brinkman's replacement rivals in importance the choice of our new warden. Being in the chief leadership position for our jail's healthcare staff, Dr. Brinkman's replacement will have responsibilities to manage and provide direction to all healthcare staff and evaluate the healthcare system at our jail. This appointment will have a major effect on the rate of people dying at our jail, the jail staffing crisis, and the quality of care provided to our vulnerable residents. Since April of 2020, there have been 20 deaths, with 9 deaths occurring during Dr. Brinkman's time as our jail's chief healthcare administrator. This mortality rate is far beyond the national average, and it's been accompanied by a significant increase in healthcare staffing vacancies. Based upon the results of our jail healthcare staff survey and conversations with healthcare staff, Penn had 4 major concerns regarding Dr. Brinkman's role as ACJ's chief healthcare administrator. Number 1, Dr. Brinkman's lacked any medical training. 2, Dr. Brinkman isolated herself, spending most of her time in her office and not in the block supporting staff and learning about the many challenges healthcare staff experience on their job. Dr. Brinkman used her position authority to conduct a very authoritarian top-down relationship with frontline staff. Her neglect in not recognizing and valuing the expertise of her frontline staff and a refusal to meet with the community endangered the lives of the incarcerated residents. 4, Dr. Brinkman created policies which violate staff licensure regulations and ordered staff to perform duties which violate frontline staff's licensure regulations. Penn was particularly concerned about Dr. Brinkman's creating policies and ordering staff to perform duties which violate staff licensure regulations. The healthcare staff survey identified this as a major reason why the vacancy rate was so high in the healthcare unit and a factor related to the dramatic increase in deaths. Penn hopes that its work on creating and administrating the healthcare staff survey and its communications with healthcare staff can be a learning experience for the board and those decision makers who will be hiring the next chief healthcare jail administrator. We must hire someone who ensures healthcare staff can work within their licensure protocols.
Thank you. Jane McCafferty.
McCafferty, MCCAFFERTY. For all of the reasons mentioned above, Penn is making the recommendations listed below regarding the hiring of our jail's chief healthcare administrator. Dr. Brinkman's replacement needs the following. 1, a deep medical background and commitment to the autonomy required by the medical staff to make clinical decisions without interference from jail administration. 2, experience working on a multidisciplinary integrated health team to have a holistic understanding of the individuals being treated and of the relevant treatments and interventions. 3, daily presence in the jail blocks in order to provide support and guidance for staff and to be aware of the duties and challenges of each healthcare staff. 4, leadership skills to be able to initiate and build substantive and transparent relationships, establish realistic goals to meet the needs of the unit and the residents, and use medical expertise to make wise decisions in unison with the healthcare team. 5, the experience, ability, and commitment to create policies and orders that no longer violate licensure protocols at the cost of high staff turnover, increased stress, and conflict is too great. 6, the experience, ability, and commitment to create and implement a whole new structure of communication in the department in which frontline staff's expertise is respected, sought after, and used in devising policy and practice for the future. 7, the experience, ability, and commitment to be proactive, not reactive, and to provide leadership with goals for the future, not just manage the status quo. 8, the commitment not to overrule doctors so that team decisions will be the hallmark of the unit. 9, the experience, ability, and commitment to assist personally with frontline duties and to order other administrative staff to assist with frontline duties during the unit's staffing crisis. And 10, the experience, ability, and commitment to devise comprehensive policies and practices to increase staff retention and decrease staff turnover, based in part on an in-depth understanding of vicarious trauma in order to assess and support healthcare staff who are exposed to the many traumatic stories and experiences of the patients they serve. The life and death of our residents, the quality of their health care, and the working conditions of our health care staff will be dramatically affected by this decision of who will be hired as Dr. Brinkman's replacement.
Patrick Tierney.
Pat Tierney, T-I-E-R-N-E-Y.
Thank you.
So I think we can all agree that we're entering a critical phase in our jail's history. And probably most of us would agree that the staffing crisis has had a disastrous effect. It contributes to the very high death rate, the very high healthcare staff turnover rates, and also the lack of quality care for residents at the jail. So that's why we think it's of paramount importance to look at the question of the exit interviews to try to understand why there's such high staff turnover and why these negative outcomes are related to that. So the best practice, we think, is to conduct exit interviews and to conduct them using a team model. Considering the critical importance of conducting informative exit interviews, PIN is urging JOB to adopt the team model to conduct exit interviews and not to delegate the interviews by a liaison who's not a board member. So this is number one, dealing with the problem of bias and individual interpretation. So research on the issue of single interviews has found that the process is subject to bias and individual interpretation. Lou Adler, the CEO of the Adler Group of HR Specialists, says the following, quote, "The impact of first impressions and personality biases is minimized using a group approach. Biases of any type tend to lead the interviewer down a path of asking questions to confirm the bias. A structured group interview with a pre-planned set of questions prevents everyone from going off track." Experts value the team concept in which a discussion occurs after the interview regarding observations, interpretations, and drawing conclusions. Such a discussion limits the danger of bias because multiple interviewers can discuss and question each other's observations and conclusions, and thereby produce a more informative and reliable assessment. Thank you.
Thank you.
Diana Hall.
Diana Hull, Hull. The importance of perception. Participating in staff exit interviews is voluntary. There is a strong motivating force for a former employee to willingly participate in an exit interview. Anonymity is a major concern. Researchers have found that chief motivating factor for someone to participate in an exit interview is the perception that changes can be made in the workplace. Talking directly to those who have authority to make changes happen is so much more motivating than talking with somebody who's not having that same authority. The perception of being valued. A person's perception of being valued is key to disclosure. Board members sacrificing their valuable time to conduct an exit interview immediately communicates to the person being interviewed a perception that the board members value him or her and what he or she has to say. The board's absence from that exit interview also communicates that the person and the process are not priorities for the board's time or resources. A concern, how the communication will be provided to board members. An important goal of the exit interview is for the board to clearly understand the person being interviewed, what they're saying, and what they want the board to know. There is no substitute for firsthand experience. The person being interviewed should be concerned that the single interviewer will not disclose to the board important parts of the interview that the person feels are vital for the board to understand. As discussed previously, the single interviewer can be reporting his or her personal bias to the board, negatively impacting the successful transmission of the interview's actual contents. Missing the nonverbal communication of the person being interviewed. If board members do not participate in exit interviews, they will completely miss the nonverbal communication of the person being interviewed. The board members will miss the intensity and some of the meaning attached to certain statements. Likewise, the person being interviewed will not experience any of the nonverbal observations from the board members because the board members are not present. The presence of board members conveys to the interviewees that their comments are taken seriously, as well as a validation that they are being heard, a perception of being understood, and confidence in the exit interview process that something could be done to improve the work environment. Thank you.
Thank you. Fran McDowell.
Fran McDowell, McDowell, Human Vulnerability in the Exit Interview. Experts in the field of human resources recognize the human vulnerability of an interviewer. A single interviewer could be having a bad day. Maybe something stressful happened that day before coming to work. With the team model, if one interviewer is distracted, other interviewers can provide extra support and focus to ensure success of the interview. The same is true of staff turnover for the liaison position. It is our hope that Karen stays and does well. However, if the single interviewer model is used, anyone in the liaison position, when leaving, will take with them the sole experience of single interviewer exit interviews, therefore weakening the value of the exit interview process. It is important not to have a static frame of reference. Board members will increase their competency in doing exit interviews the more they participate in them. Relying solely on the liaison eliminates these opportunities. When the liaison leaves, the historical learning leaves with them, and the whole process has to start over again, with a new liaison needing to be interviewed and trained, all of which takes months. Like experiences attract and unlike experiences distract. A goal of the exit interview is to maximize disclosure by the person being interviewed. Experts in the field of human resources recognize that like experiences attract, while unlike experiences distract. Commonality of experience, along with sharing of vocabulary and knowledge, increases the validation of being understood and valued. Karen, with her drug and alcohol experience, will probably connect well when talking about issues related to people in recovery.
People with serious chronic medical histories are a different story. The advantage of the team model is that the team will have a multitude of experience and knowledge in a variety of areas to help the interviewers be more effective in communicating and understanding a diverse group of staff. JOB's questionable history concerning exit interviews. In building trust, which is a key to disclosure, one must look at history and how the JOB is being perceived by jail staff. The JOB has an erratic history regarding exit interviews, doing only 2 interviews in almost 3 years, and conducting 1 recently with only a single interviewer. The perception of having only 1 interviewer who is not a board member dramatically reinforces the idea that jail staff members are not valued, and staff retention is not a priority. To change this perception, something quite the opposite needs to happen. Board members with experience regarding jail matters and authority to make changes should be a valued part of the interviewing team.
Thank you. Pat Murray.
Pat Murray, M-U-R-R-A-Y. I'm part of the PIN group. It's impossible to take notes and maintain eye contact at the same time. Something will suffer. Taking notes improves accuracy, and so is necessary for the interviewer to give an accurate and complete summary of the exit interview. The goal of the exit interview is to share an informative document with all the board members who are not present at the interview. The task of taking notes requires concentration and can be distracting. So, especially with one interviewer. Using the team model, one interviewer can be asking the questions and follow up, and the other can be taking notes and provide a second follow-up. Sometimes when you're listening, you think of a question. That helps. In the exit interview, different processes in the jail's operations will be revealed. With the single interviewer model, the interviewee's information will not be shared with all board members in the way that they were speaking of it. It's just going to be in a written summary by one interviewer. It's likely that the basic summary points will be made, but many specifics will not be revealed in a secondhand summary. Thus, opportunity for further explanation will not be taken advantage of. News travels fast in the informal networks of the jail. A person's perception of being valued, understood, and perceiving the likelihood that change can happen is much more likely with multiple board members being present if the board members receive only secondhand information from one interviewer who is not a board member. And also, fewer exiting interview employees will be encouraged to participate in this process. So the final recommendation and conclusion is that care and skill base in drug and alcohol will be very valuable part of the exit interviewing core. She could work alongside board members with everyone enriching from others' skill base. The staffing crisis is extremely severe at our jail, but the potential for change with new leadership is encouraging. PIN believes our jail oversight board needs to put its best foot forward, accepting and developing the multiple interviewee model to conduct exit interviews. Part of the board's legacy will be determined by what kind of a decision you all make regarding this matter. Thank you.
Thank you. Sharon Bonavolia.
Sharon Bonavolia, B-O-N-A-V-O-G-L-I-A. With Election Day just around the corner, Penn would like to encourage the JOB and jail administration to do everything possible to encourage voting for all residents of the Allegheny County Jail. The outcome of this next election will directly impact their lives, so they must be given all the support necessary in order to cast their votes. Penn also stands with those who seek the justice of paying residents of the jail who are working inside with no financial compensation. It's shameful. And finally, Penn would like an update on the issue of mortality reviews that are required by the NCCHC. Have any been done for the most recent deaths? If so, then according to state statute, have they been shared with all members of the JOB? If not, then when will they begin? If so, then will they be completed and shared with the JOB for all of the deaths? If we do not learn from our mistakes, we are doomed to repeat them, and lives are at stake. With that, if you are able, please rise out of respect for the reading of the names of the lives already lost. Richard Lenhart, Robert Blake, Cody Still, Daniel Pastoric, John Brady, Martin Buchek, Robert Harper, Vinkley Harris, Justin Brady, Paul Allen, Roger Millspaw, Paul Spisak, Gerald Thomas, Jerry Lee Ross Jr., Victor Joseph Zelenek, Ronald Andrus, Anthony Tolada, William Spencer, James Washington, Damon Leroy Kays, Tim Menino, Douglas Bonomo, Zachary Sam, and the unnamed person who so recently on October 14th also lost their life. May we pray for these families represented here, the friends who enter yet another holiday season without these people.
Muhammad Ali Nasir.
My name is Muhammad Ali Nasir, N-A-S-I-R. I go by Manny. I'm one of many people who table outside of the ACJ every Tuesday waiting for folks to get released, offering them resources. We saw 37 people since the last JOB meeting. People like Rodney, who I'm happy came out and spoke today. And we see quite a bit more people who haven't been recently released who just come up and talk to us, especially about their experiences in the ACJ. We met a woman last week who was only incarcerated for 2 months. And within that 2-month period, she lost her house, she lost her vehicle, custody of her children. She has permanent damage to her foot that she'll live with for the rest of her life over charges that she was eventually acquitted of. That's something that I have to reiterate. 95% of the people, whatever, even if it's not 95%, the majority of people in the ACJ have not been convicted of anything. They've only been accused. All right, now in this country, you're supposed to be innocent until proven guilty. Unfortunately, the way that it actually works is you're punished until you're able to prove your innocence. That's what happened to me. That's what happens to the majority of people. Well, not even the majority, because most people just take plea deals just to get it over with. But that's the majority of people who are in the ACJ. Now, the reason I bring that up is because if we are punishing people without due process, that's in violation of the Constitution. The same way, if we're not paying people for the work that they do, it's in direct violation of the Constitution. I have to read it out. The 13th Amendment states, neither slavery nor involuntary servitude, except as punishment for a crime whereof the party shall have been duly convicted, shall exist within the United States. So most people say the 13th Amendment states, except as punishment for a crime, you can't be a slave, right? Now, with our punitive legal system, we think that just being in jail or just being charged with the crime is the punishment, right? But the caveat, the actual caveat is if you are duly convicted, which 95% of the people in the ACJ have not been. So the majority of the workers in the ACJ who are being paid nothing, not only is it a moral issue, not only is it, you know what I'm saying, you know, I don't want to say unfair, unjust, whatever, it's illegal. It's illegal. You know what I mean? Now, I was doing a lot of research on the 13th Amendment, thinking about exactly what I wanted to talk about today. It's important for me to draw the direct correlation between our system that we now have, which is mass incarceration, and the system that it is based on, which is actual chattel slavery. In between these two, there was convict leasing, there was Jim Crow, and now there is this mass incarceration that ultimately is a system of racial and social control. That's why, even though black people are 13% of the county, we are 67% of the ACJ. That is not a mistake. That is by design. And not only that, there are more people in the United States at large who are incarcerated or who are under some form of criminal control, which includes probation and parole, than there were actual slaves in 1850 before the Civil War, which was supposed to end slavery. Now, this is the last thing I'll say. I was recently asked whether or not I believed in abolitional reform, and I said I believed in abolition. And not only that, I said that I think reforms are a hindrance to abolition, because sometimes we think once we have a reform that we've reached the pinnacle or our ultimate goal, right? So even sometimes we may think that because we're not in actual chains anymore, that we've arrived to racial equity and equality. Right? But if you think about what I just said, even more, of course, there are many books, there are many scholars who talk about it way better than I do, then you see that it's just a continuation. It's just another rendition of that ultimate racial and social control that we're all suffering under. You know what I'm saying? And not just on a large scale, even though we think about it on a large scale, but I think about it on an individual scale, because I meet these people who get out of jail like Rodney and wonder what to do next. Thank you.
Marion Damick.
Thank you. Sorry, it was late traffic, as usual. DAM. Honey. What did I do? I'm feeling myself. Oh, okay, I got it. You got it? Thank you. I'm sorry. DAMICK. Okay. I expected to come here, and, well, everything I hear, of course, is true. But trying to have an answer, I've changed my mind somewhat. This is not going to be political because it involves both sides. It's vital for everyone here, the board, everyone, ask the two candidates who are coming for county council, county executive, what their plan is for the jail. It's vital. It's vital for life, it's vital for human nature, and it's vital to know. My other thing is, I'm going to, for whoever it is, we need a new jail. I was here when we had put up this jail. I was involved in it. We didn't know what was coming, you know, street or whatever. We had horses. Anyway, I'm joking. We need a new jail. We're at Allegheny County Jail. We have a big Allegheny County. It doesn't have to be on a street next to a fast street, next to where nobody can park and nobody can get in, and the inmates cannot get out for their required time to be outside. You have to, we all have to ask both people running for the county jail, for county executive, what are their plans? And I would say, take that as your vote. That's it. Oh, whoops, a PS. I did bring a friend who is a doctor, a medical man, because he's been interested in the jail and how it's going, what's going on medically. Look, he has applied, but I think if you talk to doctors, like Dr. Fisher here, he has some ideas on what can be done for the medical care. Medical care is, you know, okay. Talk to the doctors. Some doctors not working for us, talk to other doctors and see what can be done. It's been done before. I mean, you know, I'm that old, but after he had a good medical department. We don't, and we haven't for years. That's one of the other issues. Bring up to whoever is going to be your executive director.
Thank you very much.
Thank you. And all of you remember to vote.
I love her. David Maynard.
Hello, everyone. Warden, thank you for swelling your chair over to face me. The last warden would not do that, so I'm glad that I'm able to address you directly. I just want to say how pivotal this moment is. You coming in for this period, I know it's kind of an interim basis. It doesn't need to be just riding it out until the end. You have a wonderful opportunity to be seen as a hero in our county and really fulfill the mandate of everyone that's been coming to these jail oversight board meetings for years demanding change. And all the prisoners that are in the jail, incarcerated, most of them not convicted and not being treated according to their rights. So please, I implore you, I know the challenges that you're facing are immense, coming in and being inherited to a jail with lots of problems, with the staff that's been run to pretty much the end of their rope. Please, I implore you, apply yourself to the best of your ability and work on all those problems. Work with the Jail Oversight Board, with the members of the community that come to these meetings all the time to get this done. Thank you.
Thank you. Bailey Brown.
Bailey Brown, B-R-O-W-N. I'm here to express my support for Councilwoman Hallam's motion to pay the workers in the Allegheny County Jail. $2 an hour is not enough. It should be minimum wage. It should be greater than minimum wage. Anyone who's worked a minimum wage job at any point recently knows that it's not enough, especially when you've got potentially unjust legal fees piling up. And if you on the board oppose this, I would like you to come out and say why. And if you don't believe that incarcerated folks are worth at least minimum wage, I would like you to say so. I would also like to express my ongoing frustration with the jail administration's disregard for the solitary confinement referendum. And to the board, I ask with honesty, I remain flummoxed as to how the members of this board perceive your own purview as the Jail Oversight Board. I would like to talk about it. You have a beautiful crowd of people who care, who show up month after month. I don't doubt that some of you also care. I would like you to do some addressing of the room, and I'll keep asking. As if you feel your hands are tied, let's talk about it. But we seem to be in this pattern where we come in, we express these concerns, and we are not addressed as to how the board intends to respond to these wider concerns. Things tend to go to executive session is how I perceive it after a few years of paying attention here. Thank you.
Now have the review of the meeting minutes from October 5th. Did everyone have an opportunity to review the minutes? Is there a motion?
So moved.
Is there a second? I didn't hear that, I'm sorry. Any discussion? All in favor? Aye. Any opposed? Motion passes. Now have the warden's report. Interim Warden Shane Dady.
Good evening, Board. I wanted to take this opportunity to tell you about some of the things that I've been exposed to since our last JOB meeting. I've been making my way around to different units, speaking with both staff and incarcerated, to get a barometer on what their concerns may be, and being able to then look at planning to remedy as we move forward. I'd like to start off with telling you a little bit about Title 37 audit, which was completed October 18th of this year. The audit is like a smaller version of an ACA audit for accreditation conducted by the state. The state inspectors conduct a physical plan inspection with primary objectives to review the inventories, accountability, and control of required items, and observation of conditions and general safety of the facility related to Title 13, Chapter 97 requirements. Upon the state's inspection, they had some very positive things to say about the staff that they encountered, that they were professional and courteous to them during their tour of ACJ. They have not yet released a final report, but when I met with the inspectors for our debrief, they gave me some idea of what to look for to tighten up, such as inventories and items that may need more organization and accountability in some of the different areas of the jail. One of the larger issues is to overcome will be painting of interior cells. The auditors reported that the hallways and the unit areas were clean and tidy, but that some of the random cells that they went through had graffiti, which could be removed through a fresh coat of paint. This logistically, physically will be challenging, but the staff are already planning on how to tackle this and other projects to make necessary updates where needed. The improvements of all areas is something that we are looking at. I've done some informational investigating on paint colors through the DOJ website and found information on paint colors which we could use to brighten the jail up, not only inside the cells but the hallways, and then hopefully have a positive result on the incarcerated and the staff who are there. We've begun to look at the reorganization of our intake processing area. After reviewing the report from NCCHC, this will also not be a small undertaking, but with the full support of the county manager's office, I believe that we can come up with a new space and processes for doing business that is secure and safe for both staff and incarcerated offenders. We're not holding back, and nothing's off the table. If we need a structural change in intake, that can be accomplished. Please understand some of these changes will take time, but there are some process updates we are currently implementing, such as providing bottled water and an electrolyte additive to intake and detox unit incarcerated. We are also setting up to have the plastic bottles accounted for and recycled. This is to attempt to provide immediate intervention of hydration to those who may be brought to us detoxing and dehydrated. And I can have medical talk more about that process. So as I continue to acclimate to the jail and make comparisons between county and state operations, my plan is to make improvements to assist the jail in moving forward. Thank you to the staff, the manager's office, and this board for your continued support. And that concludes my report.
I want to say something.
Sorry, no, wait, we go through the whole thing. Chief Deputy Warden's report.
Thank you, Your Honor. Good afternoon, Board. Staffing update. Our current cadet class consists of 17 who are scheduled to graduate next Thursday, November 9th. Our next cadet class will begin on Monday, December 18th. We currently have 42 in that hiring process. Awaiting PA DOC transfers, we currently have 15 males, 7 females with 300 Bs in the facility, 12 males, 1 female with detainers, and 9 males with open cases. The longest wait time on a 300B was received on June 12th, and the shortest wait time is from October 26th. Currently, we have 25 federal inmates in the facility, 15 of which are United States Marshal holds, and 10 are federal transfers for Allegheny County Court. Our use of force numbers for October of '23 was 44. And finally, I would like to announce that mental health specialist Lauren Hayden and supervisor for reentry services LaShawn Davis have been named the ACJ Correctional Professionals for the month of October. Congratulations to both. Deputy Warden Clark will continue the report.
Good evening, Board. Chaplaincy and pre-release over 120 Foundation of Hope volunteers and staff will come together on November 4th for an annual volunteer orientation and security training event. This training will include new and established volunteers. The theme for this training is 2 ears, 1 mouth, speaking and listening in a correctional setting. The next new volunteer training event will be held on April 20th, and interested individuals can go to foundationofhope.org for volunteer information. Discharge and release. In the month of October, the Discharge and Release Center assessed 349 individuals, distributed 81 boxes of Narcan, 235 fentanyl and xylazine test strips, and 487 bus tickets. The DRC continues to make referrals to community partners for services, as well as providing resources to assist individuals upon their release. The jail received a generous donation of hygiene bags for females from the organization's Sisters Lifting As We Climb. These bags are being provided to females upon release through the Discharge and Release Center. With the support of the health department and in an effort to reduce the risk of sexually transmitted diseases, the jail has been provided condoms that are now being distributed through the Discharge and Release Center. Contact visits. The jail is continuing to host contact visits for juveniles, incarcerated workers, veterans, program participants on designated Saturdays throughout the month. For the month of October, a total of 89 incarcerated individuals received contact visits from a total of 181 family members. In October, the carpeting and furniture in the contact visit room was replaced. These renovations were completed in order to make the space and contact visits more welcoming to family and visitors. Residential placement services. Based on orders from the court, the Residential Placement Services Department facilitated the transfer of 62 individuals to alternative housing in October and 47 individuals to substance use treatment through the diversion program. The diversion program received 38 new referrals and served a total of 81 participants in October. The medical assistance program assisted a total of 108 individuals with completing medical assistance applications upon release from the jail. Reentry services. The following programming is ongoing in the Reentry Center: harm reduction education, peace education, batterers intervention, Maya mindfulness and meditation, coping skills and planning, Amachi parenting groups, A Child's Place positive parenting program, PAR, Men in the Know, positive relationships, and trauma groups. Educational services. The CipherWorks learning platform launched on the tablets on October 16th. This educational platform allows incarcerated individuals to use their tablets to complete courses that will provide them with continuing education units. Individuals can access their accounts post-release and print certificates and transcripts to provide to potential employers. These classes are in a variety of categories, such as human resources and compliance, restaurants and leadership, GED, life skills, professional development, and safety. Earlier today, with the support of the Allegheny County Elections Division, voting occurred in the jail. For this general election, the jail had a total of 45 participants submit absentee ballots. Any registered voters who are admitted to the facility between now and Election Day will have the opportunity to submit an emergency ballot. Lastly, the forms that incarcerated individuals may use to submit complaints directly to Jail Oversight Board Liaison Karen DeFallo have been distributed to the housing units in the jail. There are complaint boxes on the housing units where forms are deposited. Complaint forms are then collected by staff and delivered to or picked up by Ms. DeFallo. That concludes this month's report for programs. Karen Kohler will now provide the healthcare services update.
Good evening. Thank you for allowing me this opportunity to serve our patients, the staff, the board, and the community. I'm here to represent healthcare and submit the report. Old business, medication-assisted treatment for substance use disorder, October data. 33 individuals prescribed oral naltrexone, 5 individuals receiving Vivitrol injections prior to community release. 147 individuals treated with Suboxone, 24 individuals treated with Sublocade, 17 individuals transitioned from Suboxone to Sublocade. 39 individuals continued methadone services. Torrance State Hospital October data. 6 patients transferred to Torrance, 11 patients committed to Torrance, 5 patients had a rescinded commitment due to clinical stabilization, 33 patients awaiting admission with the longest wait since July 10th, 2023. Tier 4 and 5 mental health tier system October data. 37 individuals were identified for Tier 4. 0 individuals were identified for Tier 5. Sick call request October data. 44 medical with the longest wait time of 5 days. 0 mental health. 201 psychiatrists with the longest wait time of 19 days. 3 mental health specialists with longest wait time of 11 days. Healthcare updates. It was reported last month that a hydration program is part of the withdrawal management treatment. treatment protocol was implemented. In addition to the tireless effort of staff and providers encouraging patient hydration, electrolyte fluids have been added with each meal. An addiction specialist doctor and the addiction specialist physician assistant have been meeting with the medical providers and substance use recovery nursing staff to develop and implement updated treatment plans. This team has begun to reach out to other staff to share information regarding the developments that are occurring. Though change may be difficult, the patient outcome has improved. Those patients most compliant to hydration and electrolyte intake have stabilized blood pressure. Those that are beginning to increase hydration and electrolyte intake have had increased gait stability. Most notably was the decrease in withdrawal-related medical emergencies. There were 0 of these types of medical emergencies from October 7th to October 23rd, 2023. Thank you.
Thank you. Ms. Moss, you had a question?
Well, the question, one of the questions was about, you were saying about complaint forms. You talked about how many complaint forms did you say were picked up? And these are complaints about what? Conditions that our residents have, or what? What are the complaint forms?
We don't read the complaint forms. We just submit them in an envelope to Ms. DeFalo, so I don't know what the status of the complaints are.
And that's they're given to the liaison person.
Correct.
Okay.
Complaints for her.
Yeah.
Specifically for her.
Okay, they're for her. That's what I couldn't understand. Okay. That's all.
Is that
Sorry.
it? Any other questions? Controller O'Connor.
Yes, just too quick. Can you identify yourself? I'm sorry. Are you county, state?
I'm county.
Okay.
My name is Karen Kohler-Cagle.
Okay.
Yeah, I am a deputy health service administrator.
Okay. And how long have you been there?
2 years.
2 years. Okay.
A little bit more.
Okay. That was my only question. Well, I have another one. Are we getting the update from Judge Lazaro?
She sent an email, and then there wasn't an attachment to it. I can pull it up and see if she sent.
Oh, that's all right. I mean, my concern is just the IAWF. I've mentioned it a few times. I know that there was an executive action of $700,000 to just refund it. So what we're seeing is, as this is the fund that we control for funding of what we believe are the best priorities at the jail, what we're seeing is that there's less money coming in and more money going out. So when it was under Summit, the county brought in about 55% from the commissary. Now we're down to about 35%. So this is, I've mentioned at the last few meetings that, you know, the numbers are going down. So we need to figure out as a collective board, or maybe it's a long-term conversation with a new administration that's coming in, is what funding are we going to see? I know that we've gotten numbers from the jail as well. I don't know if you wanted to comment on where you're seeing the numbers going, but that's kind of what we've been seeing from our office when we do the analytics of the fund itself. So just wanted to let everybody know that the stipends and the vaccine incentives is lowering that amount a lot. So I don't know if anybody wants to make a comment, but we've mentioned it a few times. So.
Yeah, that'd be accurate. The commission rate in the most recent contract, in an effort as proposed to the jail by this board, was to reduce the overhead costs that the incarcerated population saw in the cost of the commissary items. Part of that was the bid award with the commission rate, so it did reduce from 55 to 35%, also reducing the line item prices within the commissary menu. So that's where you're seeing your reduction in revenue into that fund.
Yeah, and just from our numbers, it's almost 55% less than last year, I assume. So just for everybody's knowledge, like, we have to have that long-term conversation internally at the board to figure out what that is. But
yeah, so overall sales, I can't speak to those, but as you mentioned at the last meeting, we've made efforts with our menus and our food vendor, so we don't know if that has had an impact to the reduction of the commissary expenses, but overall sales are down, as well as the commission rate.
Okay, that was it, Judge, thank you.
I did have a question, Controller O'Connor. Based upon the numbers that you're seeing now, how much is in the fund balance to fund that distribution going forward?
So right now, yeah, I mean, I'd have to break it down. So right now, you're at like 915,000, but each month 400 goes out. So probably right now on hand, it's like $80,000 to $90,000. I don't have an updated like for right now, but that's kind of where the numbers are going. I don't know if you have an update to date, but I know that the 700,000 was needed to continue the program for the next couple months because
Correct.
there's not enough in there.
Based on the report provided by the Controller's Office, there's a $1,070,000 balance, cash balance in the fund. There was appropriation for another $700,000 to cover the motion that was passed by the board for the November and December $125 to go onto the trust accounts.
Ms. Hallam, did you have something?
Yeah, I have a lot of things. So first of all, I can hopefully end the concerns about the Incarcerated Individual Welfare Fund, because on next Tuesday's council meeting, I'm introducing an ordinance to actually move the profits from the tablets, phone calls and tablets, back to the IIWF. Back when County Executive Honorado was in office, he made the decision to move the profits from the phone calls out of the Incarcerated Individuals Welfare Fund. It used to be commissary profits and phone call profits. It was moved out to help balance the budget back when, we had a much less healthy fund balance in this county. And so now that we, are so fortunate under the past 12 years of leadership to have such a healthy fund balance, we can actually afford to move those profits back into the Incarcerated Individual Welfare Fund so that any profits that we're making off of incarcerated individuals, which I am vehemently against, but while we're doing it, I think it should at least go to this fund so that Controller O'Connor has one less thing to worry about when it comes to auditing the county. So that will be introduced next Tuesday. It seems I have the support of a majority of council. Additionally, it is our budget season in the county. So I'm here for county council. We do the budget for the county, and I actually have some budget amendments that will specifically address this concern as well. One, for example, is actually giving a line item to the Jail Oversight Board liaison to include the salary and benefits so that that's not dependent upon how much money we have in the IIWF, but just as a fully funded position going forward. That's one of the budget amendments. And additionally, what's the other one? Oh, and the allocation for the incarcerated worker pay, which we will be passing by the end of this meeting. The total potential cost based on the average number of staff for this motion would be a little over $820,000 for the entire year at $10 per day, 365 days a year for about 225 workers at a time. It does fluctuate a little less than that at some points, but just wanted to make sure we had plenty of money and it wasn't going to be a concern going forward. So hopefully we won't have to worry about finances anymore when it comes to the welfare of incarcerated individuals, and we can just focus on the operations and other policies and procedures that we can fix here. So before I did my questions, I did want to make everybody aware of that. Did you have a question about that?
Judge, can I ask the controller a follow-up question?
Sure.
So what you were saying was if I can put it in terms, I understand, we needed to get bailed out by the budget from the executive.
For the last couple months, yeah.
Or else we would have been negative balance.
Negative balance, yeah. So this is why that executive, I forget when it happened, but it was the last couple of weeks at the budget season.
Exactly. So there would have been
There would have
nothing,
been
nothing in the,
a negative number to go forward through the end of the year.
okay, thank you for that clarification.
Thank you.
All right, do you have other questions or do you want me to go? You're good? Okay, thank you very much. All right, so first of all, I guess I'll start going backwards. Is it Kohler? Kohler, sorry, thank you very much. Are you acting in the capacity that Dr. Brinkman was previously?
There's 3 deputies, and we're trying to move forward in this training. Sorry, there's 3 deputies, and we're all trying to move forward, and we're accepting the support of admin.
Cool. And if, I don't know if you or anyone else can answer that, is Dr. Brinkman's position actively being filled at this moment? Or is the intention that throughout the administration transition that the 3 deputy HSAs would just fill that void until the new administration? That's it? Okay, thank you. That's what I was wondering. Next question is, about the voting in the jail. So that's awesome. I actually think 45 is maybe the highest number that I have heard for any election in the jail since I've been on this board. So that's awesome to hear. You spoke specifically about emergency ballots, which was going to be one of my questions if you were going to offer that. How are folks who come into the jail from now until Tuesday notified of it? Are they just asked the question, are you registered? Do you want to vote in this election? Can you talk about that?
Yeah, they'll be notified through the tablet system, through an announcement, and they'll work with their caseworkers to let them know if they are registered and want to vote.
So now people sometimes sit in intake for a few days, so they don't have tablets, they don't have counselors. So if we're talking about people who come into the jail, Friday night, Saturday, Sunday, Monday, Tuesday, how are they going to be notified? Because those are really the people that we're trying to hit with the emergency ballots.
Yeah, that's a great point. We'll look at getting some type of signage or something down there, and they can work through their caseworker teams to get those.
That would be great. Even if it's like one of the questions you ask them when they come in, do you want to do this? And if you need anybody to, serve as the courier to and from elections division to get those emergency ballots, let me know, man. Next question is about the liaison complaint form. I don't know if we can see that. Do you have a copy of that handy? Or even if Karen, if you have a copy of the new liaison complaint form, I would really like to see that. Yeah, can I see that? Thank you, Bisa. Oh, cool, and it's the carbon copy too, so they can, love it. Thank you very much. Next, we had a public comment about the mortality review. So I think, Warden Dady, this one maybe be a question for you. If you have started the mortality review process, I know it was one of the main recommendations of the NCCHC report, to start doing those, not just going forward, but also historically as well for ones that weren't conducted. Can you give us any status update on mortality reviews for deaths in the jail?
No, I have no update on that as far as the review process.
Is it something like, for example, if, somebody died in the near future, would you do a mortality review on their death?
From my understanding, I believe they do reviews within a 30-day period, but then the coroner also conducts their own review, and so that information can come from the coroner's office?
Those are two different things. That's like an autopsy versus a mortality review in corrections.
All right.
So to clarify, the healthcare group in the facility does conduct the administrative mortality review. So if you remember that there are 3 different types of reviews. There's a administrative review, a mortality death, and then the psychological. The mortality death, as we've mentioned at multiple previous jail oversight board meetings, that the county manager has contracted on with NCCHC to conduct those, and a report was provided for all deaths on mortality death review back to, I believe it was 2017, and they also contracted to conduct the most recent. So those are being provided through that office, as we mentioned at the last meeting.
Right, so is there an update on that, though?
So I don't have the copy of that report, so I would have you defer to the county manager's office to answer that question of where the status is of that report. I do not know that information. As far as the psychological review, I believe we're still looking into the procedure for conducting, as that is one of the more challenging, because that requires you to get historical information from the community. So I can't speak to what is going on with that one at this time.
Okay, do you at least know if the mortality reviews that are being contracted out have started?
I do know that when they were in with the contract for the intake evaluation, as the county manager also contracted that service, that they did conduct the mortality death reviews at up to that point in time. Again, as to the report and the results of those, I cannot speak to.
Okay. County manager office, can you speak to that?
I don't have any update this time, no.
Do you know, has the contract been executed?
Yes.
And has the work begun?
As Deputy Thomas said, they did some of the work when they were in, working on the other contract that we had with them, so some of it has begun, yes.
But that's for a separate contract, specifically on the mortality review?
For both. for both contracts.
For both contracts, work has begun?
That is my understanding, yes.
And what is the name of the company who's doing those?
NCCHC.
Oh, it's literally them. It's not just someone contracted through them. Gotcha. Okay, thank you very much for that. Next question is, I was wondering if someone could speak to the phone policy specifically in intake. I know that I've encountered a lot of folks in intake who don't speak English, who use the phones as interpretation devices. And I was wondering if you could just tell us like how often they're available. Is everyone who's in intake allowed to use them?
I think I would need more clarity in your question, using the phones to make an outside call, is that what we're referring to?
Or for interpretation purposes?
So we have the TTY machines downstairs in intake, and those are utilized not only for communication with the staff, but also when they're making a call within intake. We also have other services that we can call for interpretation services that we can utilize for translation.
And the TTY, is that like a separate thing from a phone?
Yeah, it's so that we got talk to text, so that's a device that the phone would go on, and then there is also a number that can be called that the phone attaches to. We also have them available upstairs in our video arraignment, so they can speak into the phone, and then there's somebody that translates.
And are these available to them like 24/7 while they're in intake?
Yeah, there's one down in the intake area that I am aware of.
But they're allowed to access it at all times?
If we are made aware of the need, yes.
Okay. And have you ever had a situation where there were more than 2 non-English speaking folks in intake and you only had one machine for them to use?
I cannot speak to that.
Okay.
We have more than one machine in the facility, so if more than one was needed, we have the ability to draw from other resources.
Okay. The next question, because I actually think this is a question for you. Do you know how much we actually pay for a tablet? Like the device itself, how much it costs us when we purchase it?
We don't pay for the tablets. They're provided under the contract for the telecommunications.
Okay, so is because it's GTL, right? Yeah. Is GTL the one that tells you how much to charge an incarcerated individual if they break a tablet?
I actually don't know the answer to that question.
Okay. Could you find out? Where, I just want to know where that number comes from. Yeah, it was a public comment tonight. I think Rodney brought it up, and we had heard that in the past about these are, I mean, if anybody's seen these tablets, they're like the crappiest, oldest tablets you've ever seen, like coated in plastic, and there's no way they cost $350. And so I'm just trying to figure out why that number, and if that's something maybe we could, as a policy, adjust.
I'm happy to look into it.
Thank you very much. My next question is something that came out of communication both from our liaison and also, I think, Warden Beeson, you brought it up in a previous meeting about the photocopies, and we had talked about how it's kind of jail policy, not kind of, it is jail policy to not make photocopies for folks. And so I was doing a little research, and I found this court case in which Allegheny County was named actually as a defendant. It's Pollard versus Phillips from 2021, and it actually orders that jails have to make legal copies. They don't have to provide them for free, but they do have to provide copies at an incarcerated individual's request. So I don't know have any of you ever heard of that case before or that requirement? Okay, I will email it to each of you. I just want to make sure you know we're not opening ourselves up to any lawsuits that the taxpayers would have to pay. And I'm also wondering if there's any way, it's a very short order, it's like 3-page PDF, if we could put this maybe on the tablet. I know we put other things on the tablet in the past so that folks know their legal right to receive photocopies of their legal documents.
We can look into it, but I want to make a point that Deputy Clark did bring up if there are any documents that are needed to be filled out for the courts, all they have to do is ask the caseworkers, and we facilitated that in the past. So, and also the definition as discussed last time in reference to what legal documents are. Documents that are legal documents by definition that come to the facility as privileged documents are provided to the individual as paper documents.
Yeah, so multiple instances I have of people having to, and specifically mentioned in this case of, stuff having to be mailed home and then having them copy it and then sent back in. And so I just feel like we could eliminate that step if we just followed this court case that sets a
Again, we'll
precedent.
be happy to look into it, but I just wanted to clarify what was discussed at the last meeting, that if they ask for forms, we'll be more than happy to get those from the caseworkers to them.
Yeah, I was here for that, but it was specifically about legal documents that are being made available on the tablets and not being able to be photocopied and provided to them. That was exactly what we talked about at the last meeting, and this court case specifically outlines that it needs to be made available at the cost of the individual.
And I completely understand. And next time you're in the facility and this is brought immediately to your attention, we would really appreciate to know that individual so that we could actually see those documents at that moment in time so that we can address that situation when it occurs. Because that would have been really helpful in this instance to better understand what you're referring to as legal documents.
I just don't want to be showing you people's legal documents.
But you could have had at least the names of it, like what it is. And again, if they were passed through the tablet, they were not privileged at that point in time because they were passed through the tablets and didn't go through like their lawyer. It wasn't submitted as Judge Housey mentioned before. So that's why we have a confusion on that term. And
no, I didn't mention the term privileged.
I know, but I'm saying that was our conversation about the definition as we've discussed previously. The term, they come through as privilege from their lawyer, that goes straight to them as paper copies.
Yes, I very much understand that. I am not just talking about privileged communications with attorneys.
That's where this conversation needs to occur more and us to have a better understanding so we can come to some solution.
Absolutely, I can definitely do that. I will get you some names because there's at least one or two people right now who still have the issue, so I could definitely get you some names for that. I appreciate that. Okay, and then another question, tabling outside the jail last week, and someone brought to my attention a policy surrounding visitation. I knew, even though I don't understand, but I knew that you were only allowed to be on one person's list at a time for visiting list. Even if you have 2 kids in the jail, you're only allowed to visit one at a time, correct?
If we're made aware that a visitor needs to be added to multiple family members that are inside the facility, they just have to reach out. We just have to make notification through our OMS system to be added to those lists, okay? But if they're not directly related by, a family relationship, we don't allow that.
Okay, so direct family relationships are allowed to be on multiple people's visiting lists, but if you're not blood related, then you're not afforded that same right?
Or a spouse, or, like, for example, I spoke with a lady last week. She was the mother of 2 children inside the facility, so we put her on both of those lists.
Okay, what if I'm someone that has like 2 lifelong friends that are both in the jail? I'm not allowed to visit them both?
No.
Okay, and so what is the policy from, okay, I'm on this person's visiting list, it's not my family member, and he gets out, when can I get onto somebody else's visiting list?
I'd have to look into it. I don't know if there's a time frame. I would think when it would, upon release.
Yeah, so the official policy is 90 days. And so I have a specific instance, and I'm just trying to figure out if this is like an error or if this is actually a policy. His loved one got out of jail in July, and so he hasn't been on anybody who's been incarcerated's visiting list since July, beginning of July. And he, just this week was trying to get on another friend's visiting list, and it was not approved, and he said it's in some kind of limbo status.
I understand the situation. So they still remain on that person even though they're released. So it's an administrative thing that if visits is made aware of it, they'll remove them from one and add them to the other. So we have had those instances where they just need to call in and we make those adjustments. And we'll look into the other statement you made with the 90-day and the policy, but I have personally experienced those where they have made that adjustment by phone call.
Okay, yeah, see, like I had no idea about that you actually had to, take an affirmative action to, okay, so when somebody is released from incarceration, it doesn't automatically.
We don't remove people unless we're prompted to. We've had that situation where somebody has had one person on their list and somebody else can't get in there, so, and the same thing goes for like scheduled visits, right? If somebody's scheduled to visit with that person in that time slot, we don't move them around for that purpose.
Can I give you this person's name before we leave today? Thank you. That would be fantastic. I really appreciate that. Another question is specifically about, we hear the phrase a lot, like in the red. I think we had somebody else coming up and talking about it again today. But so when someone is in the red, for example, I met someone the other day that his charges were dismissed and he was in the red to be released for 13 days, just waiting. And I know that's the worst feeling in the world, not knowing if today's the day you're going to get out and going to bed and wondering, is it tomorrow? And 13 days of that after his charges were completely dismissed, no detainers, no probation, no anything like that. Is there some policy about how many days someone can be in the red before they're released?
This would be another helpful example if you could give us the name of the individual after the meeting so we could investigate it. But
yeah, I can do that.
if all the charges, no detainers were present, they weren't waiting to go to a halfway house or a treatment place, something like that, then no.
Yeah, he was released on Tuesday after 13 days in the red, so he is out now. And he was told that his paperwork was lost. But I would love if we could look into that. I'm just wondering, has that happened before? Like, what's the longest you've known of somebody being in the red and still not being released? And what is the barrier to them being released if they have no holds?
Usually the only delay we have getting anybody out is waiting for medications to be pulled, or medications may not be present in the facility, and we have to wait for them to come from the pharmacy. So we don't do releases 24/7. There are specific timeframes that we release individuals because of other needs in our intake department, but that's usually the big holdup.
Okay. And is someone allowed to waive that? Like, for example, I just want to get out. I don't care about getting my meds. I just want to go home. I've been here for long enough. Can I say, no, I don't want to wait for that. I'm in the red. Let me out?
I would have to defer to DHSA Kohler, but I believe you can sign something saying.
Yes, you can leave, and we will make arrangements for the next day pickup too.
Okay, and after how long of being in the red is someone able to do that? Like, do I have to wait till I've been in the red for 48 hours? Is it longer than that? Because aren't we illegally detaining them at that point? If their charges were dismissed 13 days ago, the court ordered them to be released. Why are they still in the jail? And sometimes, I mean, we heard tonight 4 days. This specific example of the gentleman I talked to was 13 days, but I've heard variations in the middle as well. So I'm wondering, how are we allowed to detain people in the jail when there is no court order detaining them?
So again, I think when we go back to the some statement is we would need the example, because the statement you're making is that we held them, but we don't know that because we haven't investigated the situation. So again, we just ask that we are provided the name so we can look into it to identify who, as to what your statement that you're making.
Yeah, so you met one tonight when he was up here giving his public comment about it. Rodney was talking about being in the red for 4 days, so maybe Ians can talk afterwards. And I can definitely talk to you about the other person with the 13 days who just got out on Tuesday as well. But again, I know we can always say, hey, we can talk about these specific instances, but I think the fact that it's happening multiple times, I'm more concerned, what about the ones I don't hear about? What about the folks I don't meet? What about the people who are still sitting in there now in the red for days and not being released? I'm wondering what policies and procedures exist in the jail to ensure that that doesn't happen.
We understand, and we do have procedures that we follow, and when we do identify those issues, they are investigated. But again, these ones we would have to look into, and we can have longer, more in-depth conversations on those matters outside of this forum, or we can look into them and come back to you with more information.
So, last point on this, to clarify, there is not a rule, a law, a policy that says you will not be held in the jail in the red for 48 hours, more than 48 hours, or 72 hours, or 7 days. It would be nice for people to know that once I'm in the red, even their families, making arrangements for them to come home. I think Tanisha spoke earlier about different programs that they need to get into, shelter beds. It would be nice if there was a timeline that we could say, once your name is in the red, you will be out within X amount of days. And you're saying that doesn't exist?
What I'm saying is I can look into it. Again, Ms. Hallam, don't forget, my area of expertise for the facility is not the custody. So our team, we will look into it.
Okay. Yeah, thank you. I would really like to know that. Thank you very much. The next question I have, and I again don't know who this question specifically is for, but was about books. We had a public commenter who was asking about books and when we can expect a fully a full library with trained librarians. Is that something? I know we've talked about the library in the past. I'm just wondering at what status it is.
So we are still in the process of organizing the library. We have a vast amount of books. We do place those books through the book carts up on the pods. In addition to that, the tablet system provides a large amount of books where individuals can go onto the tablet and read them and submit requests to us for ideas and suggestions for books that they would like us to purchase in the future. And we use those ideas and suggestions when we purchase books for the tablets.
Okay, I appreciate the information about the books on the tablets, but I'm specifically talking about physical books in the library. So it's in process. I think we've been talking about this for a really, really long time.
We have built out our library. I know Ms. Moss was down there to see it. I believe Ms. Klein and Controller Connor did see the library. We did get additional shelving to finish out all of our new shelving. We even expanded to include to separate out our religious collection, because we did field a lot of, I don't want to say complaints, but we did field out a lot that since that was in our general circulation, individuals wanted to have a better balance of the type of books. Like we said, we have a queue on the tablet for them to be submitting those comments. So we worked with our chaplaincy and our Hope provider, and we are working on building out that other library so we can separate those. So the carts that go up for recreational reading are that recreational reading, and then when they're making those requests for religious material or self-help material, that's coming from a different avenue. So we are making those strides to do that, and we continue to have our book review committee that meets. They not only, as you know from me speaking at this Jail Oversight Board, they aren't only the ones who are looking at the books that come into the facility, but they also help with the curation, and we're working with AIU, the educators, to inform us as to the collection of those books, and we continue to add to both our areas, and we hope to be expanding those in the near future, but at this time, we're working heavily with those two areas in that group to do that with both the physical and digital library.
And what about, a librarian? I mentioned earlier it is budget season at County Council, so I'm always looking for what needs to be funded that maybe wasn't funded before. Do you have the plan to hire trained librarians to staff the library?
But we do have positions in the facility that can fill that niche as far as it goes with the curation of those, and we continue to develop those and evaluate our business structure in regards to those programs and positions.
And when you say there are positions that exist, do you mean there are trained librarian positions, or do you mean that there are people in other positions who could fill that role?
We have contracts, and we have vendors, and we have resources that we are continuing working with to optimize the programs and the services that we provide.
That was like a super politician answer to that question. I'm specifically asking, does a funded position exist for a trained librarian to run the library that you were putting together?
Do we have a job posted on the Allegheny County website for a librarian? No.
Do you have the plans to post a job for a librarian?
We have the plans to continue to develop our library and use the resources that we have available to us through contractors and other mechanisms to help expand those services.
I'm going to keep my peace today. So my next question is specifically about some numbers that were given earlier about mental health tier numbers and folks waiting for psych. And I don't know if I'm just conflating two different categories or not, but 37 folks on mental health tier 4 and 201 folks waiting for psych seem like way higher numbers than normal each month. Can you speak to, did something happen that increased those two categories?
Well, I do know that I looked at the 201 sick calls over the 19 days. They're for 197 patients. So there's a few doubles, but They're also being used as follow-up schedules for the behavioral health providers, so that does inflate the number.
Okay, and then the 37 individuals who are categorized on tier 4? That seems higher than normal as well.
I'll take your word for that, and I can look into that to see if it is in fact higher and what's influencing that.
Yeah, that's really what I'm looking for, is what is influencing. Is something happening? Is it a different population of folks that are coming into the jail? Like, what are you seeing that's changing?
Yeah, off the top of my head, I don't see anything that's changing.
Okay.
I do know that the behavioral health providers are seeing patients regularly and doing a lot of follow-up visits. So I can find out more about that.
Yeah, I would appreciate that very much. Thank you. And just a couple more. Whoever brought up the discharge and release center, you talked about how many, I know all the different Narcan and test strips and bus passes. That is awesome. I truly do appreciate that. When you're connecting folks to resources, because I know that's kind of that like super broad component that's at the end of all the things that you give out, is there any connection to shelters or even maybe more stable housing? And if so, what facilities are you referring people to? Like, do we have arrangements with those places to hold beds?
So we work with obtaining knowledge from the variety of shelters in the area. The Discharge and Release Center gets regular updates from them on bed availability so that they can provide that to individuals who need those resources. We also have a wealth of pamphlets and other resources that we provide to individuals that, are in need of housing so they can walk out the door with those resources.
And is the service provided where, like, I literally sit there and I say, I have nowhere to go, find me a place, and you will make them sure they have a place to go, or are you just handing them pamphlets?
We're telling them, what shelters in the area have availability based on that day.
Okay, but not actually securing it.
No.
That's kind of the next step after they leave.
Correct.
Is that something that the Discharge and Release Center, I've really heard great things about the folks who work in that area. Is that something that you would be willing to expand to make sure that people actually have a plan before they leave? Because I know especially, at least when I was in early recovery and in and out of rehabs, they always said that if you had a plan for when you left, as opposed to just leaving, that your success rates, were astronomically higher than if you just leave and say, I'll figure it out.
Right. So a couple of the challenges that we have with that is that we don't always know when individuals are leaving the jail. Right. And, when they're in the Discharge and Release Center, they're thinking about just leaving the jail,
yeah.
Right? Like, they don't want to sit there for an hour or two while we make phone calls and make arrangements. So we provide them with the resources necessary to do that.
Yeah, but would you be open to offering that? Like, if we work to expand some kind of program that, hey, I'm willing to sit here for an hour so that I have somewhere to sleep tonight.
Yeah, that's something for us to consider.
Okay, yeah, I would really like to work on that. I do think that that's, we get them all the way to this point. Let's just take it the next step and make sure they're safe when they leave.
We have a lot of community providers that do work through the Discharge and Release Center that know individuals who are in that situation and coordinate and help facilitate that transition. So the Discharge and Release Center does make notifications to those organizations to let them know that person is ready to go.
Cool. All right, thank you. Next question is about the Title 37 audit. Maybe that was brought up before. I don't remember ever hearing about it before. But I just had a kind of a broad question about it. I know you haven't gotten a report or anything about it yet. It sounds like it's kind of a mostly facility thing. Is that how you would generalize it as well? Or are they also looking at staffing levels and medical treatment and food?
No, it's more of a facility
thing. Okay. And I'm really excited about the intake reorganization. I think that is like super long overdue. And I do think it is the most evil place in the jail. And so anything you can do to make it less evil, I'm very supportive of. And so I'm wondering, you talked about the improvement. Yeah.
I have to echo on that. That's what I wanted to say. Thank you, because that has always been a source for me.
Yeah.
And that intake is ridiculous.
Yeah. Yeah, I won't even bring that up. Anyway, so what specifically from the NCCHC report, because I know they identified lots of things specifically in intake, are you focusing on in this reorganization? I know you said new space and new processes, change of the structure if needed, but can you just point to any specific things that the NCCHC said you should do this in intake that you are specifically addressing now?
I mean, the process, I know that, they had some information in there about our computer process not talking with the court process.
Yeah.
And that's a huge issue, I believe, with how ACJ conducts their business there. I mean, we're unlike any other county jail. So, but we're looking at everything. So, it's kind of in the infancy stage of working this out, but, we're gonna make it happen, so.
I appreciate that. I will tell you the last warden never took me up on this offer, but I for real am down to help with anything that makes the jail suck a little bit less. Like, so serious about that, whatever I can do, if there's any way that I can help. He never once took me up on that, but if you want to, I would like to help in some way.
I appreciate that.
Yeah, and specifically the first suggestion I will give, and then I'm truly done with questions, is something that we had heard a lot about over the years in criticisms of intake is that there's no real private space. And there are other jails and prisons that have like kind of private cubicles. When I'm coming into the jail, if I really want to get the most, support after I leave, or maybe even during there if I'm going through detox or something, if I can feel comfortable that our conversations are in confidence, I can be honest and, be met with the most appropriate services. So some kind of like little cubicle like in a bank, or like those little Zoom cubicles they make now where it can be a one-on-one, any question divulging of information and intake. So that's my suggestion, and I am done with questions. Thank you.
Any additional questions?
Am I permitted to ask a question of Renewal that I didn't ask earlier? I understand. If I'm not allowed, I'll save it for next meeting, but it's just one question, if he doesn't mind. It's not a controversial one, I swear to God. I just wanted to ask specifically about fire drills. I've been noticing so many fire drills at Renewal, specifically on 2nd Ave. That's the one that I'm near and that I see. Is that like you have an excessive amount planned or are required by law to do, or are people pulling them, or is there faulty alarm systems? Can you just explain why it seems like very, very often there are fire trucks and ambulances and fire alarms?
That meeting with the fire marshal, and so I don't know what really come about of that, but it seems to be the trend now to get contraband into the facility, especially the inpatient programs. Pull the fire alarm, go outside, make a rendezvous, and bring in a contraband or get it wherever the drop-off is. So we've been reviewing cameras and stuff like that. I know that whoever's caught pulling the call box, they will, be fined by the fire marshal, and it'll be pursued if we can identify them on camera. And pretty much all the call boxes are under camera. So. And what happens a lot of times, why that's not effective, is because a lot of people use that as a means to escape, and that's all jurisdictions.
So it is pulled fire alarms. It's not fires. It's not planned fire drills. When I'm seeing that, somebody's pulling that.
We don't have to do, we have to perform fire drills in our facilities once a month, different shifts. So yes, that's not fire drills, because that would be a little over the top.
You're getting extra practice. Okay. And do you go back to jail if you pull a fire alarm? I know when I was in high school, one of my best friends got suspended because she pulled the fire alarm, and then they ended up expelling her for the whole year. So I just have trauma around it. I'm wondering if that's something.
I believe that's still work in progress. Again, I wasn't privy to that meeting.
Okay.
Fire marshal, because it was more of a facilities thing. However, it was brought to our attention that was the intention of the fire marshal, was to pursue a fine.
Okay.
So far, to my knowledge, we have not returned anybody for pulling the fire alarm.
I'm glad.
We did identify one individual that was responsible for it the last time. Actually, two individuals in both different buildings. However, it's involved with the plan. He went to an inpatient program and they decided to just hold it for another day or two. That's what it was gonna take to get him to when the bed was available. So,
Thank you.
as of now, we have one.
I don't want to discourage you from like staying for the whole meeting because I accidentally asked you a question at a different part. I won't make a habit of that. I forgot. So thank you very, very much. I'm done.
As it relates to old business, the IIWF subcommittee report, Judge Lazare is not here. She had another an engagement commitment. She had to go to Duquesne for a job fair for students, a public interest job fair that she had already previously committed to, not realizing that the meeting was tonight. But I would like to say that I've spoken with Judge Lazare and a number of the board members regarding the liaison and the work that she's been doing. And I just want to say, and a number of people have echoed my sentiments, that she has been extremely responsive when there have been concerns or complaints or questions being asked. She's been responsive. Her reports have been extremely detailed and informative. And the people that I've spoken with have all agreed that Karen DeFalla is doing an outstanding job. So we just wanted to bring that to everyone's attention. So with that being said, does anyone intend, I don't know if anyone has the housing population statistics that Judge Lazare typically reads.
That's the email she sent earlier, and she was really trying to share it without coming here, but I just checked like right now too, and she sent the email accidentally without the attachment. So she did try, but we don't have it.
Fair enough. New business.
I'm so excited for this. So I would like to make a motion to pay incarcerated workers $10 per day on which they perform any work at the Allegheny County Jail to begin on January 1st, 2024, and to be dispersed in accordance with Pennsylvania law. And I would like to ask for a second and then hopefully discuss. Thank you.
Discussion.
Okay, so I will start off just with an overview, and then if anybody wants to discuss any merits or offer any amendments, we can chat. So first of all, we have been talking about this for a few years now. Actually, if you all look in the packets that I handed you when we started this meeting, I actually even included a WESA article that was about when we first started discussing this back in July of 2021. Allegheny County Jail doesn't pay its incarcerated workers, a common practice at jails. I've spent lots of time talking to various entities. Specifically, a big help has been the folks at the Pennsylvania Department of Corrections. So normally, I won't shout them out, but they have some really great resources in regards to incarcerated worker pay. Included in your packet, you will see the policy inmate compensation. This is the Pennsylvania Department of Corrections policy on literally every question you could ever have. How to pay incarcerated workers. What happens if they get hurt on the job? When do they not get paid? Are there any days they don't work? Are there any excused absences? How to keep attendance of workers. If you are paying by hour, how to keep pay by hour. They even break theirs down into different classes of incarcerated worker labor by the different jobs that they do. They even have a tiered system by which they pay folks. You'll see on page 1-7 to 1-8, they actually do the per day pay for the majority of workers in the Pennsylvania Department of Corrections. That is what led to this kind of amended motion from the one that we had previously discussed, where we were talking about different rates per hour for work of incarcerated individuals. It seemed like one of the biggest barriers was going to be, how are we going to do like time clock, and how are we going to make sure that folks are keeping accurate time? Who's going to be responsible for that? That is one of the main reasons for the Pennsylvania Department of Corrections per day policy. There already has to be a record of who is leaving the pod. Every single person that leaves their pod that goes somewhere else to perform work. So that documentation is already taken care of. It is no more administrative burden than currently exists. The $10 per day, I mean, I know it's ridiculous. It's like $2 an hour, actually less than that for a lot of workers. And they are working 7 days a week, which would be overtime. We're not accounting for overtime. The $10 a day is way lower than I think this should be, but I wanted to show my good faith effort to my colleagues on the board to show how important this is. I really want to get this done. I want to take away any concerns you have about the cost of it. I want to take away any concerns you have about timekeeping, differentiating between the different jobs, and just saying if you work in the Allegheny County Jail as an incarcerated person, $10 a day. So those, feel free if you want to look through the Department of Corrections policy, but it is so cool because we don't even have to figure it out because they did it for us. I know I had spoken, a year and a half ago now to someone in the controller's office about how we actually do this from a pay perspective, and it's as simple as just adding an employee categorization like we did when we created the Jail Oversight Board liaison categorization. We would do the same thing for incarcerated workers. I do have, again, the cost for the 225 workers. That is what I would say the average of number of workers who are incarcerated in the jail at any given time would cost a little over $820,000, assuming that they are working 365 days of the year. That is not the case. It's actually going to end up costing less than that. But I do have a budget amendment that is included in our budget for $1 million under the jail's budget for incarcerated worker pay, just to make sure we had some fluctuation. I didn't want to have the situation where the next executive has to flush money into the budget to pay for this initiative. The last part that I want to go over, because the last line of this motion is to be dispersed in accordance with Pennsylvania law, I actually printed out the Pennsylvania law for you all so you could see that, one of the most annoying things in my job, on county council and on this board is the second-class county code. I really think it sucks, and I'm sure most people don't even know it, but it binds our hands in so many really weird ways, and the fact that elected officials across the state are in Harrisburg dictating what we can and cannot do in Allegheny County because we're the only second-class county, but that's a rant for another time. But this is specifically as applied to second-class counties, of which we are the only one. It is very explicit that we, first of all, shall set wages for our incarcerated workers. But even more importantly, it tells us how the money is to be dispersed. And this is, while it's annoying that is specific to us, I think it is very interesting how we are required to pay incarcerated individuals in Allegheny County is different than you would expect. So if you look on the third page of Title 61, Part 3 that I have printed out for you, if an incarcerated individual, it's double-sided. It looks like this on the front, Pennsylvania General Assembly, Title 61, Part 3. It's in your packet. It's in the back. Yeah. It's that font that you have in front of you, Terry. Get to the front of that document. It's the weird, typewriter-y font. Okay, so now go to the second page, the front side of it, and it actually starts on the bottom of the second page. But the to be dispersed in accordance with Pennsylvania law is that for any worker in the Allegheny County Jail, when they start getting paid, 3/4 of any wages that they make have to go to their dependents. They can elect for 100% of the money that they're making working in the jail. That $10 a day, that adds up for a mom who's at home without her child's father trying to support the kid by her own. That helps for, a high school child trying to pay for basketball or, get to gymnastics camp and their loved one is incarcerated and can't have a job on the streets to contribute to them. So I think it's really important that 3/4 to 100% of the dependents of any worker in the jail will get all of their money directly to them to support them while their loved one's incarcerated. That's required by law. Now, for any folks who do not have dependents who are working in the jail, under this law, they won't receive the money while they are incarcerated. They will actually get a really great reentry savings plan where they will get 1/3 of all the money that they've made given to them at the time of their discharge. That helps them secure housing, pay court costs, fines, get their lives on track, and shows to greatly reduce recidivism when they know they have this income coming towards them for work that they did while they were incarcerated. They were able to be productive and learn the value of their labor. The next third of that money will get deposited, will get given to them 3 months after they leave, and then the third 6 months after they're discharged. So basically 1/3 when you're released, 1/3 3 months later, the remaining third 3 more months later. So it doesn't give them this huge chunk of money at once, but actually gives them a source of income as they work to get their lives back together. So that is how we are required to disperse this money. And you have a lot of information. You also have, the Pennsylvania Department of Corrections. I thought this was a cool little thing on their website that they talk about how important it is, not just that folks who are incarcerated have jobs, but that the wages earned through their jobs contribute to an incarcerated individual's cost of incarceration, legal financial obligations, victim restitution, family support, and their incarcerated individual's account. So there are so many benefits to this. It will really not be difficult at all to implement it. The Pennsylvania Department of Corrections has so many resources. We can truly just replicate their model. The funding will be allocated in the budget for it. And I think that we are way overdue having folks, in direct violation of the 13th Amendment of the Constitution, as we heard earlier today, working 7 days a week, at least 8 hours a day, on Sundays, on holidays, for 0 cents an hour. It's disgusting that it's 2023 and we're just doing this now, but I think it will go towards a monumental change and shift in the culture in the jail, especially amongst the workers who, remember, if we don't have them doing this work, it is going to cost us so much more money, because we will have to pay the county minimum wage to county employees who will be in unions with benefits and pensions and all of the great things that come along with being a county employee. We will have to hire those folks and spend so much more money if we don't just pay our incarcerated individuals. It is so unjust and a violation of the Constitution that they are working now without pay. It's absurd. It's time to end slavery at the Allegheny County Jail. We know overwhelmingly folks are not convicted of a crime who are in there. Folks are not convicted of a crime who are doing this work for no pay. And this is such a small cost. Let's get the program started and see where it goes. But I appreciate the second. I would be open to any discussion, any conversation. I'm sure someone's going to try to amend something, so I am very open, and I am done.
Controller O'Connor.
Yeah, obviously very supportive. As you know, we've been working on this in the office for a long time. We've been trying to figure out the framework of how we would do this, because in payroll, if you don't know, we are the ones that do the county payroll. So my only concern is, again, we're doing it in reverse. County council should pass the budget first, and then we have the conversation. So I'm not saying we shouldn't do this. I agree with it, but we're doing it the reverse, and that county council should vote next week. I know you have the votes, that's fine, but just get the votes first, then we can do it, because we have a lot of process work that we have to do on our end. So, if the board wants to have a conversation about, as you mentioned in here, this is the state policy. Do we want to just do fines and fees? Do we just want to send a check after an individual leaves? There's tax implications there too. So for us, we have to develop the framework, which we have been working on, so I don't think that's going to be a huge issue. I'm just concerned that let's do the money first and then do this. That's all. I agree with it. I just think we're doing it in a reverse order, that we could possibly do this next month, just pass the votes, so we feel comfortable that there's money to do it. That's my only, if there's a vote, I'll abstain, but I think this is the right way to do it.
You'll abstain from a vote, but you are supportive?
I'm supportive, but I would like to see the funding first. We have these conversations, but we don't control funding. So once the funding is there, that's the conversation we have to have internally as a board of how we want to do it.
Yeah, so thankfully our county exec actually took that argument away, because as you just mentioned earlier about the $700,000 that was transferred, because what we pass on this board is binding. We are the statutorily obligated oversight board. Therefore, we could pass something that costs $10 million, and guess what? The county has to fund it. They have to. We have that oversight authority that is required. So I appreciate that you, as the controller, want to say, fiscal responsibility and all that. But
I'm just saying, a month from now, once you pass the actual line item, it makes more sense, because even next month or next year, we're going to have the same conversation. So we actually need a larger conversation with council as well as the new administration. So when you pass this in a week, we will have the ability to do it for a year. At that time, we now have to have the long-term conversation that this continues to exist, because every year you're relying on a council amendment where we have to have a long-term conversation that we can continue to do this 5, 10, 20 years from now, too.
But I'm not relying on a council amendment, because when we pass this, it will be binding. It will be the law of Allegheny County that we pay our incarcerated workers.
We don't have money to do that. So what I'm saying is, when you pass the council amendment Tuesday, that gives us money to do this for a year. So what I'm saying is, once that happens and we can figure out the process and do our job from the controller's office, as well as have the conversations at the board, I'm saying we actually need a longer conversation with the new administration. It's probably a whole new board in a week or next month. So now we need a long-term plan to fund it forever. So like each year, you'll be on council for another 4 years. But then what happens in 10, 12 years when none of us are here? We want it to continue. That's a separate conversation. I understand that. All I'm saying is that for us, pass the money, and let's then do the details of it.
I think you actually counteracted your own point, because you said, according to your argument, the only way to make this happen would be to allocate a budget, it in the budget every year, and that's not true. Passing this would require it to be funded in the budget every single year. Just like anything else we would pass, I allowed what you presented as good faith amendments at last month's meeting about the uniforms, but really it was just a plot to try to kill that from happening too. But it is not true. We did not need the funding allocated for that. If we pass new uniforms on this body, the county has to pay for it. When we pass $125 a month for incarcerated individuals, the county has to pay for it. When we pass incarcerated worker pay, the county has to pay for it. I am being courteous to the next executive by doing a budget amendment, but I absolutely do not have to do that. We, as the Jail Oversight Board, are the ultimate authority when it comes to implementing these policies and procedures, which is why so many conversations have been had with members of this board about this.
Do you have any precedent for that? I understand that you've read the statute and you believe the statute gives this board the ability to initiate, enact legislation that directs the county to do things, and they're obligated to do it. But do you have any precedent for that? Do you have any case law, anything other than your interpretation of the statute that says if we enact legislation here mandating that incarcerated individuals are paid approximately $800,000 worth of income in a calendar year, that the county has to fund it?
Well, sure, the next county executive could ignore that law like so many other laws that are ignored currently. But yes, absolutely that is the case. I can give you a recent example. On county council, we, via legislation, created a new department in Allegheny County. Because we created it even before allocating complete funding in the budget, the county was required to fund that department.
My question is, do you have any precedent that establishes your belief, your position, that an enactment on this board obligates the county to fund it? I heard what you said, but I'm asking you for support. Not what county council did, what this jail oversight board did or another jail oversight board did in enacting legislation that obligated the county to do something.
Sure. So I will again point back to the fact that this is the second-class county code that gives us this authorization. We are the only second-class county in Pennsylvania. So unfortunately, there is no precedent of a comparable situation. We will be the first, and that's what we do in Allegheny County, leading the way.
But what you're saying is that because this board has the ability to administrate the things that happen in the jail, we can enact the legislation that then obligates another governing body to do something. And I understand that you believe that that makes sense, and you believe that the statute authorizes you to do that. But I will assure you, the county will not agree with that, the law department will not agree with that, and there's no precedent for that position. So just saying it doesn't make it true, Ms. Hallam.
So it is your position that despite having explicit authorization in here, I will actually read from you exactly what it says, is that, let me find where it is. The county The authorities in charge of a county correctional institution may establish a fund for the purpose of carrying out this section and may provide for the purchase of machinery, materials, and payment of wages from such fund. You're saying that you believe that we don't actually have any authority to do anything on this board that would ever cost any money because we would be telling the executive or council what to do?
What I am saying is your interpretation of the statute does not bind other governing bodies.
Well, let's try it.
Well, that's your approach to a lot of things.
And it works.
But that doesn't mean it's legal. And the fact still remains, this board historically, and there's no precedent to establish otherwise, does not have the legal authority to obligate the county to spend $1 million because we said so.
Do you believe that a budget allocation would force the county to spend that $1 million without authorization from this board?
If county council directs the county to do something, that's a different
It's
conversation.
literally not true. We allocate money all the time that doesn't get spent, so that's not true.
But the Jail Oversight Board doesn't, and that's the point. We do not have that.
We supersede that. We supersede county authority as a state mandated board. We are required to exist. We are required to be the oversight of the jail. Therefore, only we can set wages. Only we can do it.
You can set whatever you want. You can't tell the county to do it, and that's the point.
That's what setting is.
I know that's your read of it, and I'm not going to debate it because it's late and I have to go to the bathroom. But I'm telling you that at the end of the day, this board does not have there's no documentation to support your position that this board has the ability to mandate that the county set aside $1 million to fund an initiative for the jail as it relates to wages. With that being said, does anyone have any?
Do you have documentation that supports your position that that this board cannot mandate that?
Does anyone have any other discussion?
Excuse me, point of order. Judge Halsey, I would like to finish this conversation. Do you have any case law precedent that supports your position that a statutorily obligated board with state authority to provide oversight of the operations and the well-being in the jail cannot mandate a program in the jail?
We're not talking about mandating a program.
You are. You're saying if it costs money, we can't tell them to do it sans support from county council or budget authorization.
We can mandate things in the jail. You can't just say, and you all better pay for it. That's what I'm saying.
But then you're saying we can't pass so many initiatives that cost money. For example, when we did the basketball hoop on the pod for the children in the jail, I did not simultaneously have to go to county council or the county executive and ask for a budget amendment. Because we passed it as this board, we set that precedent.
Right.
We showed that we can make things happen.
Capital.
They have $10 million in personnel in the jail, so the money is there.
You're talking general fund.
Let me finish. The
$10
money
million
was in
extra
the
money.
budget for the basketball hoop. There's not an extra $1 million lying around.
There is.
Let me finish, please. For you to say, county, make sure that gets paid because we said so because we're the jail board. To tell them to do things in the jail to maintain the jail with their money from their budget is a different conversation than go find the money and here's what we're telling you to do because we're on the oversight board. There's no precedent. There's no case that supports your position. There's no statutory authority. Your interpretation of the statute is just that, Ms. Hallam, your interpretation, and it doesn't make it binding.
If your argument, I'm sorry, I'm not done having discussion yet.
We're not having discussion. I've stated my position.
But what I'm telling you is that your position is not accurate because, one, we have precedent of doing things, and if the argument is it has to be within the budget, when you look at the 2020 audited financials, which Controller O'Connor, you should be quite familiar with, that we just got in the proposed 2024 budget, the jail is over budgeted by $10 million. Guess what? It was in 2021, it was in 2020, it was in 2019. Every single year, there is at least $10 million in additional budget allocated in the jail budget because we do not have enough staff to staff the jail, but yet we keep budgeting for them. So if your argument is the money there, this is $1 million of that $10 million. The money is already in personnel. All we are saying is that personnel includes people, whether they are allowed to leave the jail at the end of the day or not. Those are workers, and why should they be worth anything less?
So overall, I mean, I think we're missing the point. But this is a good thing to do. The only discussion is that if county council is going to allot the money on Tuesday, That's
Why do you
all we
keep
have
saying
to do.
Tuesday? We are not passing a budget until December 5th.
You said you were going to make an amendment on
say that.
Tuesday. That's where I
I'm
went from.
introducing an amendment, but we don't actually vote
Okay.
on the operating budget until December 5th.
And that's fine. So once the budget is passed from county council that has the money to do this, we will do this.
It's irrelevant whether
It
county
isn't
council puts
irrelevant.
the money in
There's
or
no
not,
budget.
because of
We don't
what I'm
control
telling
the
you.
money to do it. That's all I'm saying.
Okay, so do
Everybody is
you-
in supportive of the idea. Our
No, you're not.
office has
No,
been
not
working
everyone
on
is
it.
No, you're not.
I want to do this. My office isn't working on it.
You said everyone is in support
Okay,
of this motion.
I think I'm in support. I can't speak for everybody, but
fair.
we've been working on it in our office. I am saying the simple procedure to do this is county council is going to put general fund money in a fund. It's going to be 800,000 or whatever your number was, 855, I think.
I'm going to do $1 million.
Uh-huh.
Give $1 million just to be safe.
Whatever, but once you allocate the money, then it's there and we will start processing it so that residents get paid. Now, I think if we want to have a discussion about the framework of how we do it, that's what we've been working on to try to figure it out. But like, if you're going to put the $1 million aside, that's a good thing. But I'm saying procedurally, that's what should happen before we do it because we don't control funding.
Do you
and
wanna-
that's what the debate is about. We control the IIWF, which is being depleted. So after that, this is going to be a general fund amendment. It's a good thing. You deserve a lot of credit for working on this. I applaud you. I think everybody does. This is just the procedure and getting it done properly so that we can move forward. That's why I'm abstaining.
So, well, how about, before you abstain, I'm actually going to say, then why don't we do what you offered last meeting, a friendly amendment to pending allocation by county council? If that's the case that you support it pending that, then let's put it
We did
pending
it last
that.
month, and we didn't even get a vote from county council on the money.
Because it's not budget vote time yet.
But there's still not even an amendment on the budget. That's why both processes, last month and this month, were in the reverse.
No.
We should not be doing this until after the budget is passed.
So would you
That's
be
where I stand.
supportive of, just like we passed last month's motion, if we amend this to say
No.
pending budget
No,
allocation?
I
So
am
that's not really the
abstaining on the
reason.
vote.
Let me ask a question. Does anyone else have any discussion? Terry Klein.
I have a question. Could I get, and I understand your reading of the statute, I'd like to get an opinion from the county solicitor about his reading of the statute.
I'd love that.
And whether that gives us the legal permission to request budgeting from the county.
I can't give an opinion about any of that right now. I mean, I just don't give opinions off the top of my head.
Well, well, my concern about, and this is a statement, when I reviewed your article that you submitted, in state correctional facilities, people were paid approximately $1.50 to $2.50 per day. We're based on this motion, contemplating paying them $10 per day. If you think about the highest paying jobs in a state correctional facility, they pay approximately $80 per month. We already, no, that is true. You're shaking your head. That's true. We already give each incarcerated individual $125 just for being on the census at the beginning of the month. So we're already $125 just for being there. Now, we're about to spend another $1 million to pay people on top of the $125, and we don't even have the money to pay them the $125. So for me, it doesn't make sense. I don't understand where the money's coming from. I don't think we can just cavalierly say the taxpayers will pay it. Oh, well, we just have to do it. Whether it's a good idea or not, it is not that simple. That's my position. It's not a discussion. That's just my statement. Does anyone else have a
What
statement?
dollar amount would you be supportive of? What do you think their time is worth?
The $125 that they already get for doing nothing.
Okay, and what about the folks who work?
The $125 for doing nothing because.
But they're not doing nothing.
Ask me a question, I'm answering. They already are paid more than people in state correctional facilities that do work. So at the end of the day, you don't have the money to fund that, and you're already trying to take on another initiative that will cost additional funds that you don't have. Anything else from anyone else?
I have.
They don't. It's only $3,650.
I have a question,
so
or
they wouldn't.
Bethany, it seems to me that there is quite a bit of administrative overview of this. If 1/3 at the dispersal of the funds, So who's going to be responsible for follow-up with residents who are discharged? What happens if we lose them? And what is that going to cost? Because there seems to me there's going to be, I don't know, it's certainly an administrative overhead to administer this.
Yeah, so I think that that's a very fair question, and I think that that is the only hurdle that is with implementing this program, and that's why I gave a couple months for it to be implemented so that we had time to figure that out, what that piece looks like, because that is the thing that is unique to us. There is not an example at the DOC for us to follow for that. That will be up to the controller's office, who has been working on this, to make sure that they have a plan for the disbursement of the funds. But absolutely, along with the other piece would be, how do I, because specifically in here it says how you can go about being certified as like a legal dependent to be a beneficiary of the income that they make. Also, what are the criteria for that? We are to set that as well. And I think that once we get this implemented, that's how we figure out all the logistical hurdles. That was, again, why I mentioned why I did the $10 per day instead of the per hour, so that we were doing just a few of those hurdles at a time to get the program up and running and work it out as we go on. But I do think it is a work in progress, as it will be once implemented.
Here's what I'm hearing you say. Let's just pass it, we'll figure the rest out later.
Yes, as with everything we ever pass in any legislative body. I know you've never served in a legislative capacity, but I have for about 4 years now, and that's the way that it works. We work to make the policy, and then it is figured out by our mandate.
Thank you. May I finish? So the other thing I'm concerned about is who will do the W-2s? Who will track these people down to pay it? Who will make sure that a portion goes to this person, a portion goes to that person, and another portion goes to restitution, and another portion goes to court costs? Who will monitor that? And then, what about the people that are receiving public assistance or SSI or other benefits who are prohibited from having an income? This will subject them potentially to criminal prosecution. So it's not just simple to say find the money and do it. With that being said, there was a first.
No, I just want to correct. I'm not going to let falsities go on the record here. So real quickly, I worked with the Pennsylvania Department of Revenue to answer that exact question. So that was another reason for the amount of this. It is a total of, for somebody who works an entire year, $3,650. It will not implicate anybody's benefits because of the way it's dispersed in the lump sums. It does not have the ramifications that you're talking about with taxing, because it is not considered. But because of the lump sum disbursement, it is handled in the way that a lump sum disbursement is, because it's only 3. I just didn't want you to think that that wasn't something I already thought about.
Fair enough. Are we ready to take a vote?
I would love to vote on it, yeah.
Motion's been made, properly second. All in favor?
No, excuse me, point of order. I would like a roll call vote on this.
Mr. Camara?
I abstain.
Ms. County Controller O'Connor? Terry Klein?
For the record, I am totally in favor of.
That's what you always say before you vote no, myself, Terry. Go
Please
ahead.
allow her to vote. Thank you. Ms. Klein?
I am in favor of this amendment. In fact, it was something that we talked about from my visit to the state of Maine. I am concerned that this is an unfunded mandate. To my understanding, we only control the incarcerated individuals' welfare fund. And I don't see where the money is to fund this.
Therefore?
Let's vote yes, Terry.
I am totally in supportive of this, but
Then
not,
vote yes.
but not for this process. So I hope people will understand that I'm abstaining because I don't feel like the money is there.
Thank you. Mr. Pilarski?
Abstain.
Terry Klein. Gail Moss?
I abstain also, but I am for the program. I just want to know how the money's going to be put there.
And for my vote, I am opposed because there's not enough information, there's not enough structure, there are not enough answers to the questions. So for those reasons, I do not agree that we as officials on a board should make decisions and then figure the rest out later. I think it's the reverse. We need to have our information. Yes, I'm allowed to have my vote and my opinion, ma'am. And so I vote no. With that being said,
You gonna let me vote?
Your vote?
Yeah, I vote yes.
you vote yes. The
Yeah.
motion does not carry.
And actually, do you as the chair, according to Robert's rules, get a vote unless there's a tie? Because I don't actually believe that you do. I believe that the vote is 1-0 with 5 abstentions because you only get a vote in the case of a tie.
And if you read the rest of your second-class county code, you'll see that the majority of the board has to vote in favor of a motion for it to pass. The motion does not pass. Mr. Pilarski?
The majority of the voting members, of which I am the only.
That's not true.
Motion to
We need to
adjourn.
read the code. Thank you. Meeting's adjourned.
Yeah.